the board. Today's Thursday, June 18th. It's 9:30 a.m. My name is Brian Zumwalt, and I'm the director of the county's Office of Technology and Innovation. Today, I'll be playing the role of moderator for the virtual meeting, and on the panel, we also have Don Crowell from the county attorney's office, who will be serving as process moderator for today's meeting. Before we get started, as usual, I'd like to do a quick roll call on the commissioners and make sure we've got communications, and we'll start with Commissioner Eggers.
Good morning, Brian. I'm here.
Good morning, Commissioner. Commissioner Seal.
Good morning.
Good morning. Commissioner Welch.
Morning, sir.
Good morning. Commissioner Long.
Good morning, Brian.
Good morning. Commissioner Justice.
Good morning, Brian.
Good morning. Commissioner Peters.
Good morning.
All right, and Commissioner Gerard. Commissioner Gerard, you are muted.
If I am. Good morning.
Good morning, Madam Chair. You've got your quorum, and I'll turn the meeting over to you.
Okay, great. First item of business is the state of emergency. So I'm going to turn it over to Barry.
Good morning, commissioners. The first item of business, is extending the state of emergency. This would cover the period June the 19th through June the 26th. I do want to cover, after we've had a discussion regarding this, about future times in which we can extend the state of emergency. We had previously planned a little break around the 4th of July holiday, and we may need to have another Zoom meeting to be able to cover some gap periods of time to continue the state of emergency. So I didn't want to forget that because that is something we'll need to discuss and when we want to do that. However, with the local state of emergency, we at this point are requesting that you extend it from June 19th through June 26th. As you're well aware, and as everybody's aware, we have seen, however, our case count increase. Over the past really week, our case count has continued to go up. We see it in a number of areas, but it's concerning. We knew that when we were having 1.2% of our tests come back positive, that was low. That was extremely low. And we knew that would increase as the economy opened back up. As people got back with their lives, they interact more, restaurants are open, and places where they congregate with other people are open. We knew that was going to go up. What we didn't know is how much. What we've seen, however, over the last several days is the case counts that we're averaging 35 or so go to 156, 172, but what we're also doing is a lot more testing, where back before we were doing maybe 900 tests a day. Today, and the last several days, it's been over 3,000. Yesterday was a low count number, but again, that'll fluctuate based upon when test results are actually posted. And so we will continue to see that. But the percent positive is definitely, the trend is going up. And so it's concerning. And so the question is, is what do we do about it? I wanted for us to kind of discuss that today. We've seen, for instance, St. Petersburg take action to have additional requirements within the city of St. Petersburg. I've reached out to our counterparts over in Hillsborough County, and they're discussing the exact same thing. Yesterday, our percent positive, that was a low reporting day, but we had 172 new cases, but a 12% positivity rate. But however, we look over a 5-day period, a 7-day period, it's at 5.6%. So it's still, in a relative number that is, I don't want to, certainly nothing's acceptable, but it's, if you look at that percent positive, that 12% is a spike. The concern is what happens 2 weeks from now? What happens as more of these comes in? The trend is definitely not in the right direction. So, I know that commissioners, several of you have mentioned you wanted to kind of talk through this about options. We do also. Dr. Cho, Dr. Jameson, myself, the sheriff, we've discussed different issues. At your direction, we've worked regionally to provide a much more targeted and aggressive outreach campaign. Our largest single demographic that is going up is in our 25 to 34-year-olds. They're out, they're about, they're healthy, and it's summertime, and as a result, we're seeing that community spread at really an alarming pace. Well, you know, I think sometimes we forget that even though you may not feel terrible, but you're passing that on to your mother, your grandmother, your CNAs in our nursing home. You're out and interacting with a lot of other people, and it puts everybody at risk when that occurs. So again, these numbers, the trends are not good. If you look at the overall percent positives, we are glad that we're finally being able to test at the rate in which we're able to test. But the trend has definitely been on a inclining basis and not a positive way for about the past week. And so again, I'll stop here. We have Dr. Jameson on the line. We have Dr. Cho on the line, and the sheriff on the line. So we can certainly discuss any issues, options that you think. Coming out of this, remember, as part of the emergency order, you delegated a lot of authority to me to be able to take action. And as we discuss this, I'm certainly prepared to do that. We need to nip some of this in the bud early and quickly. I will tell you, and that some of the pictures that we saw from over the weekend, where you had a band, a big band, and 100 or 200. I say kids; they're kids to me. They're young adults, jammed up on a dance floor like it's spring break again. Well, that's putting everybody at risk. That has to stop. It has to stop now. The sheriff is in agreement with this, and there are limitations there right now at a true bar where it doesn't serve 50% food. The capacity is still at 50%. And so we're gonna work on some of the measures where they may not be complying with the current laws, and we're gonna get out in front of that. But there's probably more that can be done. And so, but we also know over the last 2 months, as we had broad strokes or broad breast policies, it impacted a lot of people that were just trying to run their business and do it responsibly. And so we want to be very strategic and surgical in terms of how do we adopt regulations that go after the heart of the problem and not cause undoings for a lot of business owners that are trying to be responsible and operate their business and earn a living. So I'll stop with that and answer any questions. Again, everybody's on the line, for more discussion.
All right. Anybody have anything to say? Commissioner Justice.
Thank you, Madam Chair. Where would you like to begin? That's a lot of information. I guess maybe go back to the very beginning of where we started with all of this and talk about what you just said. No, nothing was acceptable, but the reality is we're going to have positives. We're going to have severe cases. We're going to have, as we've seen, some deaths in Pinellas County. Where are those numbers to the point of the lockdown versus the steps that we're taking with social distancing, with masks, with CDC guidelines of washing your hands, all those kind of things? Of where do we find that number? CDC said 5 or 6%. We're in that range. So I guess I'm trying to figure out where that trend line is, where the alarm bells go off when we're talking about our healthcare facilities and our capacity and that kind of thing. So that's really an area I want to kind of get your feedback on today.
Well, and I'm going to ask Dr. Cho and Dr. Jameson to chime in here, because that's $1 million question. What is an acceptable number? We know it's not 1.2%. We know there's not a cure. So we know it's going to be in the community. We also know that before we weren't testing large percentages of our population. Therefore, we had a low number because because of the number of tests. But that was only part of it. We were also in a more of a lockdown situation, and people weren't out and about. So we knew that number was going to go up. The question's where the right number is. So, again, if you look at an individual, if you look at a chart, it's going up. If you take that 7-day average, you're in that 5.6%. So, is that an acceptable number or not? What really concerns me is that Dr. Cho and Jameson both will say, and they're on the line, I won't speak for them, but, that as we've opened up the economy, there's a lag in that time period. And so what we're seeing now is something from several weeks ago. And so the pictures of some of these bars that were packed over the weekend, that's not reflected in our numbers. And so the concern being that we're going in the wrong direction, and people's behavior is increasingly becoming much more accepting of large crowds and not taking the social distancing seriously. And that's the concern. And so, we know that there's going to be an increase, but should we be taking proactive measures now to try to prevent something that would be worse in the future?
Yeah, when I looked at the data tracking that we have on our website, the 14-day rolling average was steadily on the rise for the last 8 days, and then it kind of today dipped a little bit. But the 5-day rolling average actually dipped pretty good little dip from a couple days ago, from the 14th to today. So those numbers are kind of hard to read, but no, and that spike that we saw on, I guess, the 14th, 15th, does that go back 2 weeks, 3 weeks from the changes that we made around Memorial Day? How do we read those numbers?
Well, I'd like Dr. Jameson and Dr. Chota, weigh in here. They have a lot more expertise and can advise us in terms of how to look at these trends.
I'll chime in here. Just looking at the trends, some of the major metrics I think Barry's mentioned includes the case count, the percent positivity, and then when you look at the rolling, and I'm not sure which one you're looking at, but we do calculate the 7-day rolling off of the county report, and so we're averaging over the last 7 days 136 cases daily, with, as Barry mentioned, 5.6% positivity. That number and those trends have been increasing. One of the concerning metrics that we do also monitor is hospital capacity. That's the whole reason we did the flattening of the curve, not to overwhelm the healthcare system. And what we're seeing now is an increase in our ER visits. We're also seeing a slight decline over the last few days in our ICU availabilities. I think yesterday was about 16.5%, according to the ACA report. The concern is, and you've probably seen that curve, that it's not a linear increase. It's almost that exponential increase, and it's alarming as to the rate, because we need it to plateau more than anything. And something that I've mentioned really on these calls and our meetings, it's really, we don't have a lot of tools in the toolkit other than that social distancing and the mask, and how much more can we do regarding that? I think I might have mentioned this as well, is that I like the analogy that Dr. Fauci said, that he said that the virus tells you what to do, and it's really telling us now that we're not doing enough social distancing, we're not wearing enough masks, and people forget, and we're not past COVID, where it's going to be here for a while. You saw the percent positivity at 5 to 6%. There's some people that believe in order to get herd immunity, it's going to be up to 70 to 80%. So we're really only at the second inning of this, and it's going to be with us for a while, and we have to learn to live with this virus and find that nice equilibrium point of keeping things open, but at the same time taking those necessary preventive measures. And we all really have a part in that, and relaying that message, that education piece. You've already seen it's causing disruptions in businesses and facilities. So we really need to all work together to sort of tackle this.
Well, that goes, we get inundated with emails and social media messages from across the spectrum of belief on this virus and belief on masks, from the conspiracy theories to ones that I would guess I would say seem a little more well thought out, but still are very extreme negative opinion of masks. And can you just touch again for the basics on the cloth non-medical masks that we've been encouraging folks to wear?
Obviously the N95 respirators are the best. The surgicals are less so, but the cloth, more and more data is showing, especially more so with the universal mask, you need more people to wear the mask to be effective. One study did show that if everyone wore a mask, it decreased the rates by about 80%. Both the CDC and the World Health Organizations do recommend it, especially in times in areas where you cannot socially distance appropriately, going to the restaurant, going out essentially all the time. And it's especially important if you're around somebody that's vulnerable.
And then, Madam Chair, just one more question. And Dr. Cho, you and I have talked about this a little bit, but we saw the story over the weekend from the one person who went to the bar in Jacksonville with her friends, and all 15 of her friends tested positive. When we have a tourist economy, when we have people coming in now and filling the hotels a little bit, and they're packing the bars, what is the legitimacy of contact tracing, and how valuable is that in the toolbox as far as tracking patient zero? Is there a patient zero, or are our resources better spent somewhere else?
Well, so with the contact tracing piece, it's something that we've always done in public health, trying to mitigate as much as we can with any positive case, and trying to put bubbles around them. Obviously, I think the biggest concern and the risk is that as the numbers continue to grow, that it's going to be more limited, right? That it's going to be more about minimizing some of the spread rather than preventing, right? Especially for the rate of which we're going. Just to give you an example, of the last 280 something cases identified that were positive, we've contacted over 1,000. So essentially for every one, you have anywhere from 5 to 10. So that bubbles continue, the growth continues to increase as we get more cases. I think it goes back, and that's really at the tail end of it. If you think about it, it's the response. How can we prevent it on the front end of it with the social distancing to control that number to begin with?
Thank you.
So Dr. Cho, when you talk about the masks being somewhat effective if we're using them, does that include the cloth masks and the surgical masks?
Yes.
Either one, that doesn't matter?
Well, obviously a surgical mask is more effective just by the particle size and protection on that. But in short of that, and obviously the concern is that you need to reserve for more of the hospital setting, especially if we do get to a point where we're low on medical supplies. So I would go and defer back to the cloth masks, which again, if more people were to wear it, would be effective, as studies are now showing.
Okay, thanks. Yes, Commissioner Long.
Thank you very much, Madam Chair. I have two questions and a comment that I would like to make. But before I do, may I ask your indulgence to allow the Senior VP from HCA Hospitals to make his comments, because he has now joined us on Zoom? Please.
Sure.
Thank you.
Dr. Feynman, go ahead and unmute. You should have, can you hear me okay?
I can hear you. Can you hear me?
You're a little bit low. If you could get closer to the microphone.
How about now?
That's a little bit better.
I believe if you give me a second, I can probably turn the audio up.
Okay.
Oh, I don't know if I can. I don't want to hold you up. How about now? Can you hear me a little better?
Just speak loud. I think we'll be okay, sir.
Okay, thank you. If you let me introduce myself, my name is Larry Feynman. I'm the Chief Medical Officer for HCA West Florida. We serve the West Florida division has 18 hospitals, 15 licenses. In Pinellas, we have 4 hospitals. In the state of Florida, we take care of about 1 in 5 patients who are hospitalized in the state. So obviously, we have a great interest in public safety and public health. If somebody asks me what my role is, I'll tell them that my role is to stay up at night worrying about the 2,500 to 3,500 people that sleep in our hospitals every night. My secondary role is public health, and I don't wish to tell you your job, but I assume that you view your roles as well to maintain the public health. In Pinellas, 1 in 5 to 1 in 6 patients who develop COVID-19 are hospitalized. And in Pinellas, between 1 in 4 and 1 in 5 of those patients who are hospitalized go on to die. As you look at the statistics, we've had an almost exponential growth in positive cases. Certainly, we could make the case that that exponential growth is due to increased testing, although I will tell you that it's not entirely true that we have almost universal access to testing. That said, yes, it is correct that more people are tested than were tested before. Despite that, with a larger denominator, one would expect to see the mortality rate drop. But right now, the mortality rate of people who develop COVID-19 and test positive is about 3.7%. To give you a reference of what that means, you have a probably 3 times greater chance of dying from COVID-19 than you do from open heart surgery. To put that in perspective, to me, that's terrifying. When we compare it, if we try to compare it to the flu, the general death rate of the influenza is about 1/10 to 100th of 1%. So this is not anything to take lightly. So with that background, I am just begging you to think very carefully about mandating masking when indoors in public places. I see from the people sitting in the audience, you have a number of doctors there. You don't need me to tell you that it is effective. I oversee the care of 15 COVID units in our division, 4 of which are in your county. And I am more comfortable walking into our COVID units than I am walking into the Publix that's down the street from me. I am terrified when I walk in there because the only people that have a mask on are me and the cashier. And everyone else, or not everyone else, but about 2/3 of the people don't. If your role is public health, it's incumbent on you to strongly do whatever you can to see to it that the public is protected by masking when they're indoors in public places. That's really what I wanted to get across today. I'm happy to answer any questions you have for me. Otherwise, I'll leave you to your business. But thank you for hearing me out.
Thank you so much.
Thank you.
Commissioner Welch.
Thank you, Dr. Feynman. Just wanted to ask a follow-up question, and thank you for joining us. Speak to us about the ICU bed capacity, which on our latest report is at 59 beds.
I guess what would be interesting is more the what the capacity to fill it is. And right now in our county for our hospitals, our ICU capacity, we're about, I looked at it this morning, I apologize for not having it written down, somewhere around 30% of our COVID patients in the ICU are on ventilators. When we look across our state, our hospitals in the state, the highest I saw was about 50% of the COVID patients in ICU were on ventilators. As far as the ability to accept more patients, right now we do not have a problem. Our ICU has the capacity to take more patients in the ICU, and our floors have the capacity to take people. So we're not at a crisis at this point. But Commissioner, when I looked at the growth, the exponential growth over the past 2 weeks of positive cases, I have to admit that does worry me looking down the road a couple more weeks.
Thank you, Doctor.
Thank you, sir.
Commissioner Eggers.
You're muted, Commissioner Eggers.
Thank you. Dr. Feynman, thank you again for being here. Just a question. We've talked in some of our meetings, the ones that we have emergency meeting in the morning, about this disease. And I think, we're trying to educate folks, and it needs to come from the medical community. One of our folks says, the more we learn about this disease, we realize we know less than we thought we did. What are you seeing out there as far as lasting effects of this disease that we can, we're trying to obviously alert people, educate people, make sure people understand the severity of what we're dealing with. And sometimes just telling them what we know or what we don't know in a certain way can be effective. So I leave that to you. Thank you.
I would say that the most frightening thing is the what we don't know part, Commissioner. The long-term effects. I'm sure you've read on social media stories of people who are 2-3 months after the acute event, still bedbound, still sleeping half the day. We know that it affects more than just the pulmonary status. It was initially thought to be a pneumonia, and once you got through the pneumonia, you should probably be okay as long as you survive. But they're finding multiple organs involvement. The first patient, I don't know if you're aware, but the very first patient to undergo a double lung transplant from COVID pneumonia, to the physicians, maybe they saw pictures of the lungs. It looked just absolutely terrifying, the damage that was done to this young person's lungs from this disease. So you're absolutely correct. We probably don't know the half of what the full effects of this disease are. We do know people still, I'm sure you hear from Dr. Cho about people trying to go into nursing homes. We have to hold them in the hospital sometimes for a week or more because they don't clear the virus on PCR testing for weeks. Some clear it quickly, no question about that, but some don't clear it for weeks, which means theoretically they could be contagious for weeks. The best I can say is as time goes on, we'll learn more, but right now it's a frightening disease and we don't have the full effects of what's going on with it.
Thank you.
Commissioner Peters.
Thank you, Madam Chair. And this isn't for Dr. Feynman. It's really for Dr. Cho and Dr. Jameson. And I want to indulge me on this. So I went to the federal OSHA regulation website. And I want your opinion about if this is true for this case, what your opinion is on this. And it's kind of long. There's two pieces I want to go over. So I really want your opinion on this. So the OSHA regulations, which is the Federal Department of Labor, makes every workplace abide by their OSHA rules, which include washing hands. But on that website, it talks about masks. And it says a cloth mask will not protect the wearer against airborne transmissions, infection, diseases as a result of a loose fit and a lack of seal to the face. In addition, they say the same thing about surgical masks with a loose fit. And then they also talk about on the COVID page on the OSHA website that for some workers, wearing a mask or a mask or presents or exacerbates a hazard. For example, cloth face coverings could become contaminated with chemicals used in the work environment, causing workers to inhale the chemicals that collect on the face coverings. And over the duration of the work shift, cloth face coverings might also become damp from workers breathing and collect infectious materials from work environments, droplets, and other people's infection respiratory secretions. So workers may also need to use PPE that is incompatible with the use of a cloth face covering. Where cloth face coverings are not appropriate in the work environment or during certain job tasks because they could become contaminated or exacerbate heat illness. So my concern that if we do what St. Petersburg does, and we mandate that every employee wear a face mask, would we potentially be putting them at danger by wearing a wet mask or a loose fitting mask or constantly touching your mask? When I go out, I see many servers, and when they start talking, the mask is down below their nose. And so the mask isn't covering their face. So would you agree with what the OSHA website says about the face masks not necessarily being a protection the way they're stating it? I'm curious about your opinion. And then there's another section I want your opinion about as well.
So I'd like to address that if I could. I've heard these same arguments, ma'am. There is clearly a disconnect between what you might find on the OSHA website, what you might find on the CDC website, and what you might hear from various sources around the country. And that disconnect has been part of the problem when it comes to us dealing with this disease. And it's sort of not surprising that when we're dealing with a disease that we have limited information or knowledge about, that folks interpret things differently. There's a hierarchy in respiratory protection, and a fit-tested N95 respirator, which is not the same thing as a mask, is near the top of that list. That's what I wear every time I walk into a patient's room in the hospital. That's what all of our paramedics wear every time they see a patient, something equivalent to that. And that's not the same thing as a surgical mask. Surgical masks were designed to prevent surgeons from contaminating their wounds on their patients. They weren't designed to be respiratory protection from an airborne or droplet virus. Additionally, procedure masks is an entirely another category. Those are the ones with the elastic ear loops, not the ones with ties. And then finally, we have cloth masks. The science behind aerosols and how they transmit from one person to another is extremely complex and extremely technological. There are multiple papers being published every week looking at how well these masks perform in all sorts of different environments. A contaminated or soiled mask or a wet mask is clearly less effective because it loses its electrostatic charge and ability to capture particles via that method. There's actually two different ways that masks work. One is via actual filtering of particles physically, and the other one is via electrostatic charge of capturing some of the particles. But the difference between an aerosol that is a droplet size and an aerosol that is an airborne or a size that is larger than that or smaller than that, excuse me, is a spectrum, and it's extremely technologically difficult to weed that out. So the best guidance we have right now is that a mask in and of itself will not protect you, no matter what kind of mask that is. An N95 respirator or a P100 respirator should protect you quite well. But a surgical mask, a procedure mask, a cloth mask, depending upon the type, how it's worn, how long it's worn for, how well fitting it is, and whether there's contamination with other chemicals, particularly oils, will all affect how well they work. And so while masking is one strategy that's extremely important when other strategies cannot be implemented, it is not the only strategy. The primary method of preventing a respiratory transmitted virus is by not breathing air with viruses in it. And the primary method of doing that is not being near people who are breathing out viruses in their air. All of these other things are tools along the way with varying levels of effectiveness. That being said, clearly, if you have to be in an environment where you can't avoid that air, a mask can help you.
Dr. Cho, I'm assuming you concur with that, but I just wanted to hear from you as well.
No, I agree with that. And again, it goes back to something like Commissioner Eggers. I think we're learning about this virus and getting more information on a near daily basis. For the most things in terms of both infections, both in terms of chronic disease, we have decades worth of data. And as you know, we really didn't learn about this virus since December of last year. But with that being said, again, I would defer to the experts, some of the literature that are coming out there in times in times where you cannot properly socially distance. I would again defer back to the CDC guidance as to recommending masks and cloth masks.
Okay, so there's something else on the OSHA website that I want your opinion on. And then I kind of wanted Jules' opinion on it as well, because I was in a conversation with somebody and this concerns me as well. So oxygen in the atmosphere, that if the oxygen in the atmosphere, which must be at a 19.5% oxygen, that if you're wearing a cloth mask in particular, but even as thin as a thin fishing mask, when a test was done, the carbon dioxide that people were breathing in within seconds was past it had depleted less than the 19.5% ratio of oxygen in which the people were breathing as a result of that mask. And the reason I ask if that's true, now this was my experience the other day. I had gone to a facility for a tour, it's my first in-person meeting, and I wore a cloth mask, and within about 15 minutes, I started to feel faint, lightheaded. I got a little nauseous, and I started to hyperventilate. So I had to untie the bottom half of the mask so that I could breathe without hyperventilating or feeling nauseous or faint. So is what it says in OSHA is that very quickly, within seconds, that 19.5% oxygen ratio can go down. Do you think that's a factual thing? It was my experience, but it wasn't in 2 seconds. It was more like 15 to 20 minutes. And so I'm curious if that's kind of a valid point that they bring up. And I worry if you're working out in heat, what does that make with the sweating and then that breathing? And if the oxygen isn't at that 19.5%. What's your thoughts on that?
I'll jump in on that. I'm not sure if you were asking Dr. Cho or me, but so I have seen some limited data about the levels of carbon dioxide and the levels of oxygen in folks who are wearing masks for longer periods of time. I know from personal experience that you can sometimes feel a little bit short of breath while you're wearing a mask, particularly if you're speaking a lot, and particularly if you're exerting yourself. That's a real sensation that some people do experience. I am less convinced that actual measurable numbers will be impacted by that, particularly in a mask that's functioning properly and has a good seal. But you raise a good point that wearing a mask is not comfortable all the time. And you raise a good point that some people will be very uncomfortable in the mask, and it's difficult to do, particularly if you're working hard or sweating out in the heat or any of those things. This is something that we deal with literally hundreds of times every day with our EMTs and paramedics who are out there in the heat on the street wearing these masks. It is difficult. It's also difficult to wear it for 12 hours straight in the hospital like I do. It's very uncomfortable. So that's a real concern. And it's one of the reasons that I say that masks are one tool, but not the only tool in dealing with this. A good analogy is, in order to stay safe in your car, first, you have to drive defensively. That means know your risk, go slow, obey the traffic laws. If you're a high-risk person, don't put yourself in those scenarios. Don't go out to the restaurant or wherever else. If you live with somebody who's high risk, know that risk and take responsibility for mitigating that risk. That's the first part, drive defensively. Then you want to wear a seatbelt, right? Anytime you're on the road, because somebody else may hit you, you want to wear a seatbelt, right? And that's just a standard safety thing we would do. But hey, maybe you have a car with airbags, and that's, equivalent to washing your hands and having good, clean surfaces around you, right? Just because you have airbags, you wouldn't no longer drive defensively, and you wouldn't skip the seatbelt just because you have airbags. All of these things need to go together. But what's clear to me at this point is that we're dealing with a virus that is primarily transmitted in a respiratory route, and large gatherings of people close together without those other preventative measures is simply inconsistent with slowing or preventing the spread of a respiratory virus.
Okay, and I understand everything you said, and that's a great analogy. I appreciate it. So my next question then is for Jewel. So because the OSHA and the Department of Labor gives these guidelines, and they're updated guidelines because it's a very specific COVID page, would an employer who mandates an employee wear a mask be at risk for a lawsuit for depleting somebody's health because they wore that mask? And would they be at risk because of violations of ADA laws as a result of them forcing an employee? I don't know if you have an opinion on that. I'd appreciate your opinion, but I've gotten several emails that said they're worried about getting sued by employees regarding the ADA laws. And if somebody wore a damp mask because we were sweating and they were breathing in the chemicals, would they then be at risk of being sued by their employers, do you think? Is it highly likely or no?
Well, let me start by saying, anybody can sue us for anything. It's just a matter of whether they've brought a good suit. I would also say that OSHA regulations only apply to federal employees. However, here at the county, we have implemented some policies to voluntarily follow those policies. We, of course, always follow the ADA. And to the extent that we get requests for accommodations from employees, we certainly follow up on those requests and, go through the process to determine what's appropriate. I will say, even in regard to the St. Pete order, in regard to masks, which I do have a copy of, they very clearly stated in there that if you have issues breathing or you have respiratory issues, that would be an exception to the pronouncement that you need to wear a mask. And certainly those are the kind of things that in particular we're going to look at with our employees. We haven't mandated that employees wear masks. Certainly that's something that, would be up to the various employers within our system. But as one of your employers in the system, I can tell you, we would certainly be paying attention to the ADA or anything that could be arisen. I mean, as to, liability, that's something I would want to get with the attorneys in my office that have greater experience in employment matters than me. And we could certainly speak, but, again, we always are mindful of the ADA and issues that employees have going on. And I do think that, it's important to look at some of the mandates that have been out there. And I'll just speak in regard to the St. Pete one, because it is one that we have here, and it is one that I've, taken a look at. And I will tell you, one of the things that is right in there is that, any requirement in that order, to the extent that it conflicts with the ADA will trump. So, my advice to any of the employers within the county system would be that obviously, should we mandate that our employees wear masks, which again, we have not done, we would certainly recommend that there be a caveat for the ADA, which there is anyway. But we would certainly want to make that, readily evident to everyone. And I don't know if I've asked your question, again, I can follow up and get some more specifics. Like I said, I'd want to talk to our employment lawyers. But I wouldn't foresee imposing something like this on our employees as a problem, assuming that employees are going to bring forward the concerns they have under things like the ADA or, health concerns that they have.
Jewel,
Okay,
I have a question, please.
Sure.
Wouldn't you be more liable telling your employees that they can't wear a mask? I mean, I was appalled the other day to hear that there was some facility that told an employee they couldn't wear a mask because it might scare the tourists. That's insane. I mean, from a liability standpoint. And don't we have some responsibility to accommodate those people that want to?
Accommodations come in all forms. I can tell you, and I know, again, from speaking with the other, and I keep calling them employers, appointing authorities are what you all are used to hearing us say. I'm using the word employers just because I think that makes better sense to the public. Many of us are working from home. So that is one major accommodation that those of us that are able to do that have made to our employees. I'm here in my office today. You can probably see from behind me, but a staff of 33, there's maybe 5 of us here, and I'm in an office with a closed door. So we are making a lot of accommodations. I can tell you, I would never tell an employee that they could not wear a mask, especially in an office setting such as this. And I'm sure the county administrator could speak to, what his preferences or any policies that he may have in regard to his staff. Sheriff's a big employer, he's on here too. But, to the extent, if we were asked here, we would probably advise not to tell people they could not wear masks. I can tell you, my preference would be to tell employees, don't give anybody a hard time for wearing a mask. If you don't feel safe, we're going to let you work from home, and we're certainly going to, take a look at all these things, in particular to employees that come forward that have any of the risk factors or multiple risk factors, for instance. But yeah, I mean, I would certainly not favor any kind of policy of telling our employees they could not wear a mask. I mean, that runs contrary to, even the discussions that you all have been having at a policy level for the greater community.
So yeah, and I think we're looking at the greater community more than our own employees. I'm hoping that we'll have some mandates for our own employees.
Madam Chair,
Yes, ma'am.
I would like to get back to my comments and the couple of questions that I had before Dr. Feynman spoke. In the meantime, though, he has sent to me via text some additional information, which I feel compelled to share with you from a professional point of view. There are 3 of them. Number 1, masks protect not you, but people around you. This virus spreads on droplets, and masks stop droplets from leaving your immediate area and coming to those around you. Secondly, highly susceptible respiratory patients shouldn't be out in public. Otherwise, speaking as a surgeon, I'll tell you that no one has ever passed out due to low oxygen levels. Number 3, I'd worry more about getting sued for not making employees mask their employees due to risk of death. So those comments are from Dr. Feynman. My issue that I wanted to speak about, if you would allow me, Madam Chair, is that, I want to share an experience that I had myself about a responsible business owner who walked up to a person that was sitting in a waiting room and told them that they must wear a mask in their facility. The gentleman responded by saying, I don't have one. And then the owner said, well, then you'll have to leave this area and go find a shirt or find a scarf or wear a mask before you will be allowed back in this building, and we will not serve you without one. So responsible business owners can be responsible for the number of folks that they allow in their facilities. I know that in the past, we have talked about the overwhelming crowds down at Caddy's and in some of the bars at night, where young folks were gathering with no mask or any concern at all about this issue. Well, the business owners can monitor how many people get in that facility. And when they get to their 50 or 75%, the doors can be shut and they don't allow anybody else in until somebody else leaves. So the other thing that I want to make sure we're being sensitive to as we talk about perhaps mandating that business owners make their staff wear masks is that that creates an enforcement issue for our law enforcement people. And my concern is putting them in an untenable situation to be able to enforce, especially given the tensions now between the police and our citizens. So I do think that there should be some responsibility on the businesses to enforce what is common sense. That's where I want to leave my comments for right now. Thank you very much.
Well, and Commissioner Long, I don't disagree with that, but I'd like us to be talking about what is the alternative, because they're not being responsible. People aren't being responsible. Business owners aren't being responsible. What do we do as the county government?
Well, perhaps we need to hear from Sheriff Bob about how he thinks, or I see Barry's hand is up. Maybe he has some ideas. I don't pretend to have all the answers. I know that as leaders in this community, we have a responsibility to do something.
Yes, we do.
Yeah, there you go.
Who wants to jump in on that one? Commissioner Welch, you guys can.
I do. Thank you.
Okay.
Been a great conversation, and certainly from hearing from Dr. Fineman, I've kind of changed some of the issues I wanted to point on. He's hit on a lot of important topics. I was trying to think, does this remind me more of the fluoride issue, where we had health professionals giving us advice on what we needed to do. And unfortunately, it became political and big government and a big argument, but we really didn't have any alternatives, and we had clear outcomes that were going to happen if we didn't act. It reminds me of that. And it also reminds me of when there's a storm approaching and we know it's coming, and we ask folks to evacuate, and some will choose just not to. They don't believe what their government is saying. So both of those seem applicable to me. I just want to get back to, and it kind of hits on what you were saying, Madam Chair. What are the goals here? And the goals from the start have been to flatten the curve, to protect our healthcare system capacity, and to safely reopen and avoid another shutdown. And I think we have tried strong recommendations. We've tried messaging, and we're still trying to expand that. But we knew weeks ago, and we talked about it. And I've talked to the sheriff and others about it. Folks were not social distancing. I mean, you saw it on Beach Drive weeks ago, and now we're seeing the outcome from that. We've talked about the percent positivity as something we need to watch. Well, now that's over 12%. 30% of the cases have been in the last 7 days. We had a new peak yesterday. I mean, we see the storm that's coming, and that's not even counting in the fact that phase 2 of the reopening was just June 5th. So we really haven't seen that impact, and we certainly haven't seen the impact of the protests, and folks absolutely were not social distancing. So, we've got a problem here, and we've got limited tools to deal with it. And so I do have the same question. If we don't act with masks, what will we do? to act here. I'm concerned as well. Dr. Feynman touched on it. I support Mayor Kreisman's order, but I think Monroe County passed one yesterday that's broader, and it not only requires business employees but the patrons. And he hit on an example that I've talked about. Y'all know my daughter works at Publix, and I pick her up just about every night. And the workers, those essential workers, are there every day. They're wearing the mask to protect the patrons. But half of the patrons coming in there, or Home Depot, or you name wherever, are not wearing masks and endangering the very people that we're depending on to keep our economy going. And so I think we have the authority to put the force of law behind a mask requirement. We've tried not to do that. We've tried to ask, and folks are not responding. And we're not going to get 100% compliance, but if some of the literature says if you just get another 10 or 15% of people to wear a mask, that might make a difference. And I do think there are a group of folks that once they see a county ordinance, they'll comply with it. Not everyone will, but I think it's important enough that we send that signal that if you're in a public space, if you're in a business, you should wear a mask. And Jewel hit on the exceptions that are in the St. Pete order and in Monroe County as well. If you have trouble breathing, if there's an ADA conflict, those are already in there, and we certainly can tweak it. But unless I hear of something else that we can do as a county commission, I think it's time for us to move forward with that. And I'll just end by saying that we did receive email from Paul Ray, Gulfport council member, Jim Oliver from Seminole, asking us as a county, if we're going to move forward. And if we don't, they indicated, at least Councilmember Ray did, that he's going to go back to Gulfport. So rather than have each city try to address this, I think we should do what we have the authority to do, and that's to have a countywide mask requirement. And it's not permanent. It's to re-flatten the curve and try to get to a place either where there's a vaccine down the road, which is really the only, and Dr. Jameson and Dr. Chill, please jump in and correct me at any time. But herd immunity, as we heard on the other call the other day, that's not going to happen. That requires a whole lot of pain, and 80% of the folks to be infected or have a vaccine. So I support us moving forward with it. I don't see another good alternative, and we see the storm that's coming. The data is telling us and compelling us, with a third of the cases in the last 7 days, decreasing ICU capacity, and the coming storm of phase 2 and the protests that I think we need to act.
I agree.
I would agree. I think, Commissioner Peters, you seem to have more to say.
Well, I did want to finish my comments before. Jewel, Florida, the state of Florida has OSHA laws too, and every business has OSHA regulations put in the bathrooms about washing hands and stuff like that. So enough on that. My question is, Jewel told us in another meeting that if we were to enforce this, what would be the charge? What would be the thing? And she said it was a 2nd-degree misdemeanor and up to 60 days in jail. So are we prepared to put people in jail because they didn't wear a mask? That's my question. And I'd really like to hear the sheriff and his comments on his thoughts on all of this and enforcement, and maybe his ideas on approaches.
Who would you like to hear from first?
The sheriff.
Thank you.
Well, there's so much there and so much that's being discussed. I can tell you, nobody's going to jail for not wearing a mask. It's not happening, okay? And I'm not doing it. So as far as that question goes, I can tell you that in hearing you and hearing the discussion is, I think the people who you need to get to are not the people that you're targeting with a mandatory mask requirement for the public at large. I think it makes sense for employees because of their repeated contact, the repetitiveness of contact with multiple people throughout the day. if you take in restaurants as an example, you can't eat with a mask. The people who are causing the greatest problem, I think best we can tell, are where you got 300 people in a bar, in a dance club, that are sitting there at 1, 2, 3 o'clock in the morning, and that they are wall to wall, shoulder to shoulder. And I can show you a plethora of pictures that I've received. You can enact all the mask order you want. They're not going to wear one in those clubs. And I think it needs to be more lasered and targeted. I think the remedy needs to be targeted more towards the people that are causing the biggest problem. And that is, again, these mass gatherings where people are wall to wall and they're making no effort whatsoever. We are seeing some of this within some restaurants that are at 75%, and it's a very borderline. Come on, what's the difference between 75% and 100%?
Seriously.
And so, I think there are some things that you might consider that would move it in that direction without going as far as across the board everywhere. I'd suggest to you, and I know there's differences of opinions on it. I'd suggest to you that I think it's more problematic having those 300, 400 people that are in a bar, in a mass gathering event, than somebody who collaterally happens to be walking in the same aisle at Publix. So target those big things, the restaurants. We have a lot of restaurants that are making a good effort, but there's a lot of restaurants, and I know from personal experience as you do, that are not. Do something where they are forced to separate those tables more. Do something where you limit the number of people. One of the things we found that doesn't work, and I'm telling you from experience in this in the last now 4 months, this percentage thing, forget it. It's not enforceable. It doesn't work. People don't know what it means, and then people find a way around it. You got to find very simple, very hard and fast, very black and white, where everybody knows what the rules are. So as an example, with these bars, no more than 50 people. That's real easy. I can go in and count heads. Anybody can count heads. Is you're limited to 50 people. Don't have 300 people in there. In restaurants, as an example, is that occupied tables need to be 6 feet apart. That's easy. Okay, that way, if 4 people show up in a car together and they're a family and they've been together all the time and they show up in the car, those 4 people sitting there at that table, if somebody else is right behind them and they're 1 feet away, then yeah, nobody's wearing masks. Then sure, you got exposure, you got vulnerability. But if the next table is 6 feet away, then you're mitigating the risk. Those are the things that I would look at. But to get back to Commissioner Peters' question is, I'm not putting anybody in jail for not wearing a mask. That ain't happening.
So I guess I have a question about that. I mean, I've been to a restaurant that I won't go back to again, where the waitress was going from table to table. I sat 6 feet away. There was nobody around me, but the waitress is going from table to table with the mask down around her mouth.
Well, that's a problem, Commissioner, and I would wholeheartedly agree. I think that anybody that has repeated contact, like servers in the restaurants and people that are in the service industry, I wholeheartedly with you 110% on that, because those are the people that are again, when you're at a table 15 times in a shift and you're sitting there talking to people and you're passing it around and all that, I wholeheartedly agree with you. I think that's common sense, and that does make good sense to me. So I wholeheartedly agree with that. And it's especially in that service industry, or where they're having contact, or they have an alternative. If you have somebody, let's just take a shoe repair store. Okay. So a guy's coming in and they're getting people that are coming in and out all day long. You can assert any business you want. But if that business owner decides that they're going to put up a big, firm, substantive plexiglass shield, and they've got a little window cut out in it, and he doesn't want to wear a mask while he's there, but he wants to put the plexiglass shield up, that works. That's fine. But I would agree in that environment, you shouldn't have nothing where people are coming in and out all day long. You're transacting business, and there's no barrier at all when it's repeated, because I agree with you on that. I'm with you on that.
And that's kind of what St. Pete did, the
right.
Public-facing staff.
I think Mayor Crestman got it right on that as far as that's concerned, because of the repeat stuff. So I don't have an issue with that, and I think that makes good sense.
Okay.
So Commissioner,
sorry.
Yeah, well, no, because the sheriff kind of went down that path. I think one of the issues we wanted to accomplish this morning is you're hearing from your constituents, and so we wanted to hear from you. However, the sheriff, myself, Dr. Cho, Dr. Jameson did meet and discuss kind of options and alternatives. And we can take those, but I wanted to outline that because the sheriff, kind of threw some of that out there. And so you can kind of see where we're at. Commissioner Welch took it an additional step and said everybody go into an indoor place. And so we can certainly scale this up or down, but we really kind of geared around coming at the demographic. We know that it's 25 to 34-year-olds. We know that. And we know that these bars where they're packing in and having a live band and they're putting 200 people out on a dance floor is a problem. It has to end. And so, you know, we come up with a couple things. One, there's a certain type of license, and I want to get this right in terms of the licensing because it's critical. I learned so many about licensing and stuff over the last 3 months that I never would have known because there's all kinds of different licenses. But let's get that license right, where it's that bar, it's not a restaurant, you know. And if they've got that certain type of license, that they're limited to 50 people. Why is 50 people? Under phase 2, you can have no groups greater than 50. It allows them to open, but it doesn't allow you to put 200 people out with a band, you know, up on a stage and have kids congregating and then going, you know, back and being around grandma and friends and everybody else. So we could very specifically limit that. We also can limit it to your serving to customers that are seated. That it gets away from that large congregation. And, you know, Sheriff's got a great picture down at PCI. And, you know, they're all around the bar and they're waiting and there is no social distancing going on. We want to allow businesses to operate, but we've got to nip where we see these problems. That's a much more targeted approach to trying to get ahead of this. We also agree that the 75% capacity, we need to enforce it. It is a law. These business owners have to enforce it. And, you know, I feel for the business owners. We had the night before last, I talked to all the presidents of the Chamber of Commerce. And one of the problems they're having, it's like with the beach. Sheriff knew that after they get on the beach, you can't move them. Well, it's the same way with a business owner. Once he has a packed bar, it's impossible for them to get people to respond. Very, very difficult for them. Puts them in a bad spot. They got to get it ahead of before they come in the door. And they've got to limit that capacity and they got to manage that. Otherwise, the situation gets away from them. And then it becomes a law enforcement issue. And that creates, you know, a lot of other dynamics. So we know that they can limit their capacity. They can have tables 6 feet apart. We need to put that in. And then masks for those that have customer interaction on indoor facilities. And so that would then get to targeting where we know that's a problem. That server, most of them are doing that. But you know, if I had a server coming out, they have a table, or I mean a big thing of food right next to them, and they're not wearing a mask, would that concern me? Absolutely, because they're interacting with people all day long, hundreds of people, and so we can expand that. But I want this discussion because you're hearing directly from your constituents. We do have other ideas, so we can certainly expand that, contract that. But I put that out for just you know, consideration as we kind of zero in on where everybody's at on this.
Commissioner Welch.
Thank you, Madam Chair. And I do think those recommendations are good because they're really two different problems. The social distancing, which you're speaking to, and I think it's good ideas for the 6 feet separation, the 50-person limit that you mentioned, Barry, and the sheriff. But we got off track on this arrest issue, and that's really a red herring. That's not, we weren't talking about arresting folks. We were talking about, I think, giving our businesses some support from the force of having a county ordinance, and they can say, this is the reason why we're asking everyone that comes into our store to wear a mask. There's a county ordinance supporting that. I think that's going to help our businesses out. And if we go the route that you're suggesting, Barry, I think those are good steps, but it still does not address the fact that those essential workers and businesses are wearing masks to protect the patrons. But there are folks walking down the aisle in Home Depot or Publix or Walmart without wearing a mask, and they pose a risk to everyone in that area if they are asymptomatic. And some of the latest literature that talks about the aerosol effect says it can go tens of feet and stay in the air much longer. And Dr. Jamison or Dr. Cho can correct me on that. And so that calls for masks even more. So I still think we need to move in that direction. It's not about arresting people. It's about taking a step that the CDC recommends, our healthcare experts recommend. If everyone would wear a mask when they're in a public place or in an establishment, it would help us to deal with this. It's not about arresting people. And I just wanted to make that clear. If I could, Madam Chair, I wanted to show what Monroe County did, because I think it's very clear if Brian can pull up that. And this is on their website. They passed it yesterday or the day before. And I'll just read it for folks that can't see. The Monroe County Board of County Commissioners has voted to make facial coverings mandatory throughout Monroe County, effective immediately. Facial coverings over the nose and mouth must be worn in business establishments and other public settings where there is a roof overhead. Now, I'm not supporting that roof segment. The ordinance applies to employees and customers. The ordinance contains exceptions when face coverings may be removed while seated to eat and drink in a restaurant or bar, or while exercising in a gym if at least 6 feet away from other people. Talks about cities that can adopt different ordinances. I think it's important in their next paragraph, they describe what kinds of coverings are appropriate. It says a covering over the nose and mouth may include a face mask, homemade mask, or other cloth, silk, or linen covering, such as a scarf, bandana, handkerchief, or other similar cloth covering. Medical and surgical face masks, such as N95 masks, should be reserved for healthcare personnel and other first responders with the greatest need. And if you can go to the next slide, I just want to show their graphic, which I think is really good. It shows where masks are required in a business while working in a business or restaurant open to the public, and when they're not required at your home while eating or drinking in a restaurant while in your vehicle. And that's just from Monroe County. I think that's a good model. I think the model that the city of St. Pete has laid out is good as well. And I just think we need to take that step now to include masks in those situations. Thank you, Madam Chair.
Commissioner Peters?
So I have a question. We know that if somebody sweats and the mask gets wet, it traps chemicals, it traps viruses, it traps all kinds of things in the mask, and it stays there. We also know that disposable masks, once you wear them, they're no longer good. Unless I'm wrong, doctors can tell me if I'm wrong, but if I reuse my disposable mask for an entire week, every single day, is that mask effective for me or the other people that I'm around? So the question is, I have 2 questions. First off, Commissioner Welch, you said it wasn't about arrest. Well, it really isn't about its arrest. It's about, are we going to enforce it and are we not going to enforce it? And if we are going to enforce it, what does that look like? So that's my question about that. But if we're going to mandate masks, and you want to go so far as even patrons wearing masks, are we prepared to provide every single person at least 6 masks a day because of them sweating or it being disposable and then throwing away? Or, you know, we're just going to mandate that people wear a sweaty mask that's really not going to protect them and could make them sick because they wore it. So that's part of my concern too, is we're going to put this on people who can't afford them, can't afford to buy a box of disposables so they can use 6 a day, because my doctor sent me a whole litany of stuff, which I haven't even read yet, that says it would take at least 6 masks a day, even for her employees, based on how much time they touch it, move it, adjust it, make it tight to fit tighter. Her recommendation is you have to provide 6 masks a day. So who's going to provide those? Who's going to pay for those? Are we going to make every single person pay for 6 masks a day, or have 6 masks purchased or make so they can wash them every single day, at least 6 masks? And, you know, is that reasonable? And I honestly, you know, I respect my doctor's opinion, and there's a whole lot more I can read about it, but it's okay to just say, oh, we're going to mandate this, and maybe some people do it. Or are we going to write a law and not enforce it and just hope that people are going to do it because we wrote a law? And I get real concerns about that. Are we going to enforce it or are we not? And how are we going to enforce it? And what's the penalty? That's a lot of my questions. And how are we going to make sure everybody has a mask, and everybody has a mask that is safe for their health and everybody else's health? So I think this is a really big quandary that we're talking, and now Commissioner Welch is talking about every single person in this county, 1 million people, should wear a mask. And does that mean children? Are toddlers going to be required to wear a mask when they go into Publix with their parents?
No.
So those are a lot of questions that if you want to mandate patrons wear masks, where does that stop? How do you enforce it? What are we going to do with that? I got problems writing laws that won't be enforced.
Okay, again, We're looking for solutions, not why things won't work. Commissioner Seal.
Well, my goodness, this has certainly been an enlightening discussion, and I know that there's all kinds of different views here. I think what we need to do is as much common sense as possible. So I guess one of my first questions is, in other areas where they have seen a dampening of the percentage of infections, is it because they had a mandatory mask policy? So, i.e. New York City or other areas that had outbreaks. What were the most effective things that they put into place that helped to dampen the curve? And so that's going to be probably my question for the sheriff and Dr. Jameson and Dr. Cho. One question that I have that we haven't even talked about is, what about gloves? Many retailers are already requiring people to wear masks, and they give them masks as they go into the stores. Many retailers are wearing gloves. And then my final question is, in St. Pete, they made it a municipal ordinance violation where section 1 through 7 of the city code apply. What's the consequence there? And I don't know whether Jewel can answer that. So that's what I'm putting out there for now. Would like some answers, and then I know we'll discuss this some more. Thank you.
So I'll try to answer a couple of those questions if I can. The correlation between all of the various mitigation steps and what's happening in the numbers is early yet. Nobody can tell you 100% that this is effective or that is effective. We simply don't have enough experience with this virus to know that. We are left with extrapolating from what we know about other viruses, what history has told us about other pandemics, and what we know about the science of particle dynamics as they're moving around. Those are the particles that carry the virus. And I'm not an expert on aerosols or anything like that, but I do know there's some basic generally accepted principles. In an ideal world, if you have a virus that's transmitted primarily respiratorily, the best solution is to stay apart from other people. And I think that the amazing work that our community did, staying apart from each other, flattened the curve. I think it worked. I don't know that 100%, but I think it worked. And what we know at this point is that the curve is no longer flat. We have exponential growth, which is the opposite of a flattened curve. But I also know that there are things that our community would be willing to tolerate and not willing to tolerate. And so what we need to find is, what can we do practically that folks are willing to do to mitigate this? Now, in a perfect world, nobody would be in contact with anybody else, but that's not sustainable for the year or more that we're going to be dealing with this. And so we need to find what solutions in the meantime we can do that folks are willing to put up with, to endure, to sacrifice. So that's number one. And, some sort of ongoing social distancing is probably a great step. Some sort of mask use, whatever that looks like, is probably a very helpful step as well. Gloves in sort of general life are probably less effective. The surface transmission is a possibility. The newer data is saying it's not quite as significant as we used to think. The wiping down the packages and all that kind of stuff that folks were doing is probably not entirely necessary. And certainly wearing gloves into the supermarket and going from place to place to place, handling things without changing the gloves isn't really the effective thing. So I'm not sure that I would focus quite so much on the gloves, but the basic things that we've said all along: staying apart from other people, wearing masks, practicing hand hygiene, disinfecting areas, those are the things that we're left with. And it's really a discussion about how much of that we can do and live with.
Well, yeah, and I would agree. I think that what we saw that flattened the curve was the lockdown, and that's what helped in New York City. We're trying not to go there.
Exactly.
Commissioner Welch?
I was just agreeing with your point. That's what we're trying to avoid, is going back to a lockdown. And this will be my last comment, because I know you don't like back and forth, but To the 6 masks a day comment, you know, I've never had to wear 6 masks in a day. For folks that go out to a trip, they're going to a store, they're going to a pharmacy, that's when they would wear the mask. It doesn't get contaminated right away. So I just wanted to respond to that comment. Thank you.
Thank you. Okay. Yes, Commissioner Justice.
Thank you, Madam Chair. And I know Commissioner Eggers has been waving down there.
I got you. Sorry.
Just a couple of things. One, I think, you know, it is that what will people do and what will they go along with? What can be enforced? The things the sheriff and Barry outlined early, I think I'm very comfortable with all of those. But I can tell you, I was in a Panera this morning, and they do a great job as far as the separating. Not all the tables are usable, all those kind of things. And I wore a mask in. I took it off when I sat down to have my coffee. I put it back on as I left. But customers are tense. The folks that are obviously not respecting those things are not happy with the people that are. I'd personally like to see that incremental, where it's the employees that have the public contact, that we're reducing the crowd controls, those kind of things first, before we went to the next level. That's my personal 2 cents. My question, though, is also to maybe Dr. Cho. We talked about this at the very beginning, but I really believe that, and you can tell me if we're already doing this, a level of responsibility on our folks that work in our senior living facilities, our long-term care facilities. I know that they're learning about infection control. I know they're learning about all these things. But is there a code of conduct, a code of ethics, something along those lines that say, yes, you put in your 9 to 5 here, but your responsibility is really 24 hours a day now, that you can't be one of those 200 people crowding a dance floor. You have to take all those steps extra. What are we doing to encourage our long-term care facility employees to take that responsibility 24 hours a day?
I think for the most part, it goes back to the education piece. And you make a valid point, especially with the long-term care facilities. That's obviously one of our focus areas because of the congregate setting and with individuals that are particularly vulnerable to disease. We have been messaging, we have been relaying that. And a lot of this ownership and the responsibility should also fall on the facilities and the owners themselves to relay it. And beyond the long-term facilities, you can say the same thing for any employer for the most part, right? Whether it's a hospital, whether it's a business, just relaying that the message is that you could potentially bring it back to the establishment, bring it back and spread it within the establishment to the patrons, etc.
Right. Okay, Commissioner Eggers, sorry.
Thank you. I appreciate that. And I, just sitting back and listening to everybody kind of talk through this, and I think that's what we're doing. We're getting an awful lot of information from different sources. Ultimately, at the end of the day, we would love nothing more than to have government not involved, and that everything would just work itself out and we wouldn't have to do anything. So people out there who think that we're doing this for control, they just don't understand. That's not what we want to do. We have a sense of responsibility towards public safety. And I was thinking about this the other day. I said this to somebody and they said, well, that sounds pretty good. But if you won't be selfish and take care of yourself, be thoughtful and take care of others. And I know it's kind of a feel-good thing, but at the end of the day, wearing a mask, as we heard over and over, is about taking care of somebody else. So if you have this philosophical thing that masks, I am not going to wear a mask, then understand that you could be, we don't know for sure, but right now you're going to be hurting somebody else. And I think that's the messaging that we've got to continue pushing out there. I mean, because, it's kind of a cultural change. I mean, if you go to certain parts of the world, masks are just a normal thing. I mean, again, that it's more acceptable. Here, it's an infringement on rights. It's a nuisance. It's something we're not used to. So I think we just need to understand that we're trying to take care of each other, but take care of the other person predominantly. I like the idea of indoor facilities being looked at and what we're doing and the efforts that we're making, targeting the folks that are inside. Some of the comments, Barry, that you made, I think we've got some of the laws are in place. We're just not enforcing them. And I think we need to go at that. And we need to go at the facilities that are serving others. I like that idea, the concept of those employees that are interacting with the public regularly probably need to be having masks. Again, I get back to the comments that Commissioner Peters said about mask availability. That is an issue. We heard that if you have a breathing problem or if you're having a hyperventilating moment and you take the mask off, that's an understandable and allowable thing. So we're not like trying to hurt people by doing this. Or if you have a sweaty mask or it gets dirty and you take it off because it's not effective and you don't have another one, you come back with one the next day. I think there's things that we can do there. On what Commissioner Welch was talking about, requiring patrons to do it, is the part that I'm wrestling with. I certainly believe, and I brought it up last Thursday, that our grocery stores, our drugstores, our hospitals, our doctor's offices, places where everybody has to go. It's a new essential business, not necessarily the old essential business established, but the new one that we talk about, that everybody should be feeling as safe as possible there. The 90-year-old person who wants to go to the grocery store, somebody says, well, they shouldn't go. Well, who are you to say they shouldn't go? That may be their one trip of the day that they've had. So I think if we tell people, if you go inside, go to a grocery store, go to a drugstore, go to a doctor's office, those are places we must go. We must do everything possible that we have at our disposal. And that is the social distancing, obviously the washing of the hands. That doesn't pertain to what we're talking about right this minute, and the masks. So I would be supportive of those carefully defined essential services being required, the patrons being required to wear them. And I think that would be a good start. Doing what you said, Barry, about approaching those areas. I think the sheriff's made the comment, laser focused on the problem areas. And I think we can do that as well. And I'm not saying it's easy. I'm not saying that, but somebody made the comment, well, how are we going to enforce it? How's it going to happen? And others said, and I agree, if it increases 15% participation, 30% participation, and those 30 people start seeing more people wearing them, so they feel more comfortable wearing them because they feel a little bit different about wearing them. I just think it can build a momentum in the right direction for now, because clearly I think the analogy that Commissioner Welch said about the storms coming, we haven't seen the effect of phase 2. We certainly haven't seen the effect of the protesting, and that's coming. And so I think the numbers down to 15% availability in ICU beds may not be alarming. To me, it's not alarming, but it is concerning. And so we'll be monitoring all of those things. So I'm certainly comfortable looking at those businesses that interact with the public, mandating that, and mandating patrons at those 4, 5, or 6 essential businesses yet to be defined, but that they must wear them as well. So thank you for letting me weigh in.
Okay. Maybe we should pause here and see what we have from the public coming in.
Agreed.
At this time, if there are any members of the public that wish to speak on this agenda item, please hit *9 if you're coming in on the telephone line, or raise your hand virtually in the Zoom meeting. And Madam Chair, we do have one person that wishes to speak, a couple actually. The first one's going to be Trevor Burgess. Mr. Burgess, if you can go ahead and give us your first, last name, spelling, address, and you'll have 3 minutes to address the board.
Great. Thank you, everybody. This is Trevor Burgess, TREVOR-BURGESS. Thank you very much for having this meeting today and allowing the public to speak. Today, I'm calling for science-based leadership. The great thing about science is that it does not care what you believe. The virus does not care what you believe. If the national and state leadership will not protect us, then you must. Leadership is hard. Leadership is what people need. Dr. Jameson and Cho both explained that distance is best, which at its maximum is called a lockdown. But if you don't want to have a lockdown, then we have to try other things like mandatory masking. You don't have time to take baby steps. As a business owner, I do not want a lockdown. but the virus may give us no choice. Japan and other countries have controlled the virus with widespread mask wearing without large level lockdowns. My husband and I have purchased 20,000 masks for the city of St. Pete to try and do our part. If you do not require masks for all now, we will be locked down. You have been elected to protect us. Now do so. COVID Local is a website put together by a group of experts for local governments. They help you know what metrics to look at, when to open, when to lock down. COVID Local says that we should be locked down at 5 cases per 100,000 people per day, measured on a 5-day rolling basis. We are at over 15. We are at over 3 times the level where experts say we should be locked down. Do not just rearrange deck chairs on the Titanic. Take action. If you don't have the stomach to lock down, then please require mandatory masking for all in public places. But even with mandatory masks, you cannot let up on being vigilant. Ask your medical advisors about exponential growth and what it means. If you only take a baby step today, you will be back in a week and wish you had done more. This is not a storm approaching, this is a tsunami. Thank you.
Thank you.
Thank you, Mr. Burgess. Our next speaker, Madam Chair, is Karen Mullins. Ms. Mullins, if you can give us your first, last name, address, so you'll have 3 minutes to address the board.
Thank you, Madam Chair. This is Karen Mullins, K-A-R-E-N-M-U-L-L-I-N-S. I have been on mandatory quarantine twice during this. I am at high risk. As most of you know, I've had several health issues. I was horrified yesterday. I walked into Home Goods with my daughter, fully masked, and I saw a lot of people not wearing their mask, walking very closely to me. I understand. I wear an N95 mask when I go into public places. What I was horrified to see is people touching their face, touching their mouths, touching their nose, and touching the products. If we're not going to take responsibility and make these people see how they are affecting other people, I don't understand how one person can take it on themselves and say, I will not infect the whole area around me. It is irresponsible, and I just don't see it. And as for the sheriff not enforcing the masks, I am horrified, just horrified. You don't have to arrest somebody. You don't have to put them in handcuffs, but you can give them a ticket. So thank you for listening to me. I do working on a list of merchants and other establishments that do wear the mask and do require the CDC, or that do follow the CDC guidelines. This is how desperate I am. I can't imagine how desperate other people are. Thank you for your time, Chair. Thanks.
Thank you.
Thank you, Ms. Mullins. Madam Chair, we have one more speaker. I do not have a first and last name, so if you'll go ahead and unmute yourself and give us your first, last name, spelling, address, and you'll have 3 minutes to address the board.
Hello, my name is Norma Wood, N-O-R-M-A-W-O-O-D. I am a nurse practitioner. While I definitely feel that we should require mandatory mask wearing, and I particularly appreciate Commissioner Eggers' suggestion as a compromise that we require it for all employees, but also for patrons in essential businesses. I'd also like the commission eventually to address the issue, perhaps not today, of what happens when a business has a COVID exposure. We've recently had multiple restaurants in St. Petersburg closed down, and yet we've had at least one restaurant in Northeast St. Pete closed down for 24 hours. they do state they are contact tracing. I think we eventually need to look at what needs to be done to be more consistent in that regard as well. I also want to thank the Commission for allowing the public to listen today and to speak.
Thank you.
Madam Chair, there are no other speakers that wish to be heard on this item.
Wow. Okay. Yes, Commissioner Welch.
Thank you. First of all, Madam Chair, I would, when we get to a point, support Commissioner Eggers' recommendations for moving forward. But before that, I just want to follow up on Ms. Wood's question to Barry and Drs. Cho and Jameson. What is the protocol when a business is impacted by COVID-19? Is there a procedure they have to follow, and who regulates that, or is it self-regulating?
No, Dr. Jameson can answer that. They do follow up on each case. And so go ahead, Dr. Jameson. I'm sorry, Dr. Cho.
Okay, so it's part of the contact tracing piece of it. It's going to see who were positive, but it's also assessing, looking at factors as to what position they were, what kind of exposures, what kind of cleaning practices they have. If it's isolated or they didn't work necessarily during an infectious period. So it goes back to all that tracing when they were infectious in the time of work, how many of potential exposures. We certainly refer them back to and have them follow the CDC guidance on businesses.
So follow up, Madam Chair. So every bar and restaurant that we've heard about, St. Pete, even up in Palm Harbor, y'all are working with them actively on contact tracing?
I believe that should be the case, yes, sir.
Okay. Thank you, Madam Chair.
Commissioner Long.
Thank you, Madam Chair. I too would like to support Commissioner Eggers' recommendations. I think they are very well thought through. And I have one question with regard to that, and the question is of the sheriff. Sheriff, I understand your reluctance to be arresting people for violation or non-compliance. So perhaps there's a compromise that can be reached. And I'm curious about what you would think or how we might go about perhaps in the ordinance that we create, issuing the woman who spoke, and I apologize, I didn't get her name, after Karen Mullins suggested tickets. But I'm wondering if we were to impose fines for non-compliance, is that something that you might be willing to just hand a person a ticket like you give a traffic ticket, and then they are committed to paying a fine for non-compliance? I don't know if anybody else think that's a good idea, but seems to me it is some effort to let people know how serious this is. You wouldn't be letting somebody drive 120 miles an hour down 19 without a ticket. And quite frankly, you could equate this virus to that in terms of how quickly it's spreading. So that's my question. Without putting you on the spot too much.
Well, it depends what you all are doing. I'm not clear what Commissioner Eggers, you all said you're supporting what Commissioner Eggers has put forward. I'm not clear on what he's put forward. So I guess I need to know what that is. And, I'd caution you to stay away from these terms of essential businesses. It doesn't work. If you're looking at specific things, I'm telling you, don't go there because it's going to be a mess. We've already experienced this. We need to learn from what we've done and what has not worked. You got to stay away from those broad categories of things. And you're going to carve out exceptions. And if you're talking about carving out exceptions, I just read in the St. Pete ordinance. And all somebody has to say is that, well, I have a health condition that prevents me from wearing a mask. And that's all they have to say. And then they're outside of it. So, if you are going to do something, I would strongly recommend that you not make it criminal. Is that what you were talking about? And my response was to the question that was posed to me earlier. So clear about that. The question was posed to me earlier was, it's a second-degree misdemeanor. Will you enforce that? I will not physically arrest somebody and put them in jail, and I will not give somebody a criminal record, whether it's either through a notice to appear or a physical arrest for not wearing a mask. I'm just not doing that. If you want to make it a civil violation, that's something that we could consider. But again, it's going to come with a lot of exceptions. And again, all somebody has to say is, I meet one of these exceptions. And that's what it's going to become. So again, this is very difficult. I get it. Everybody is always wants to get to the same place. It's the different lanes and how you get there. But if you're going to do something, again, I caution you about these ambiguous terms, because it makes it absolutely impossible for us. And then people just wiggle around it.
And I think maybe we need to, it's probably going to take more than we can put together today to do something like that anyway. Although I think we can do the basic things that we were originally talking about, what Barry and you were talking about. Commissioner Seal?
Well, first, can we hear from Jewel? I'd like to hear what she has to say, and then I would like my turn. Thank you.
What I would suggest, in getting very much at the sheriff's comments, if we're going to go forward, for instance, under Commissioner Egger's proposal, if we're going to require patrons, I recommend we specifically say in grocery stores, in pharmacies, and be very specific, because we don't want to get back to the situation where we were arguing with car washes. You know, even in the St. Pete ordinance, even the St. Pete order there, you know, there's some things in there that I would change as well. You know, one thing we could do, if you all wanted to move forward, we could work with the county administrator on language, hearing your comments today, and have the county administrator could sign an order. We could draft an ordinance, and I would want to be sure about this, and potentially bring it back to you on Tuesday and enact it as an emergency ordinance. If you go through this as an ordinance, then violation of it would be an ordinance violation. I want to look into this too, but even violation of an order that you adopt under your emergency management ordinance may be an ordinance violation. I want to look into that, you know, more, and maybe talk with the sheriff about his comfort level with that. But we could certainly look at ways that there would be a citation issued rather than any kind of arrest. And just to be clear, violation of your orders under this, I believe it's a second-degree misdemeanor, it's punishable by up to a $500 fine or 60 days in jail. So there is an ability to write a ticket. I'm not going to speak for law enforcement, but there is. It's not just a 60-day. It's not just 60 days in jail. There is a fine associated with a misdemeanor violation. But again, my recommendation is, if you all are going to go forward, we would want to be very specific which businesses this applies to. If it's every business, I would want to say that. You know, not wanting to be critical of what other local governments have done, but they've really more called out the types of businesses where this would apply. If you want to make this apply anywhere a business interacts with patrons, then we should just say that, or just say any business open to the public. And just be very clear, because we certainly don't, again, want to get into arguing over, you know, is a car wash essential or not? And again, if we are going to say that patrons in certain businesses need to wear masks, then my preference would be to be extremely specific about which businesses we mean by that. Because in my opinion, and I don't want to speak for the sheriff, we're better off naming a grocery store, a pharmacy, and being very specific, and maybe even by accident leaving one off, rather than creating confusion or an inability to enforce because of lack of clarity. So again, that would be my advice. And again, you know, if we want to bring clarity to things, the county administrator always has the authority to issue orders that clarify things. You know, so again, I would suggest, if you want to do something today, either give direction to the county administrator, and we can work with him on language, or we could look at bringing back an ordinance on Tuesday. And again, I would want to look and make sure that we were within our right to bring it back as an emergency ordinance, meaning that it would waive your 10-day notice requirement and some of the other things. But we have options.
But getting back to Joel's point, and this is the problem with this, and one, Joel, I want to just clarify, because people are listening, they're hearing this, is if it's a second-degree misdemeanor, that means it's criminal. And it means that there's an option for a judge, okay, to make a determination whether it's a fine or jail time. And I can't see any judge jailing somebody. But I'm just saying is that it's not just a fine, okay, it's a crime. And even if we issue a notice to appear, that means somebody has a misdemeanor criminal arrest record. That means somebody going applying for a job, somebody trying to get into the military, somebody applying for, have you ever been charged with a criminal offense? They would have to say yes to that. That's what I'm not doing. And so regardless of what the disposition is, it's still a crime and it still creates a criminal arrest. And people are going to have to answer yes to that criminal arrest question for life. And then they can get it sealed and expunged, but still they got to answer that. This is what I'm saying is that's why I'm not doing that. I'm not giving somebody a criminal arrest record for not wearing a mask. As to this other, okay, what's a grocery store? Is that a convenience store? Is that Target? Is that Walmart? Then you're going to get into this, well, in the grocery section, then I have to wear it. But if I'm in the automotive section, then I don't have to wear it. Trust me, we've been there on this, okay, is that you can't define your way out of this or into it. It just, with these terms, because a pharmacy, what's that? You know, it seems simple and common sense, but I'm telling you, experiencing this for the last 4 months when we were under this, it was impossible.
Okay, Commissioner Seal.
Thank you. This is sort of what I really wanted to hear. So I think that we should start enforcing the phase 2 as already been discussed earlier. The 50 people max, the 6-foot social distancing, enforce the 75% capacity, limit entrance. This could address immediately what we're able to do. I agree with the sheriff wholeheartedly. You have to make this simple and it has to be understandable, and you can't be carving out certain places and not certain places. The easiest way to define it is any indoor facility. I mean, that's pretty, you open a door, you're inside someplace, then you know you need to wear a mask. So I don't, if we can do it as a civil violation, I certainly do not want to do the 2nd-degree misdemeanor in any shape or form.
But make it for every indoor retail establishment similar to Monroe County. I would support that as well.
Me too. Commissioner Eggers.
Commissioner Eggers, you're muted, sir.
Specific defined places. And I know the sheriff has some issues with that definition. Again, the alternative is to do nothing or to do everything. And we're trying to find a place where, where we are at least sending a strong message and at least providing places of safety for people who have to go to the grocery store, who have to go to the drugstore. Again, the definition, well, what about if you go into a Walmart? Well, you don't have to wear that. It's the people who work there who have to wear it, according to what I'm hearing. So I just want to make sure I'm clear that the idea would be that everybody would knowingly and willingly wear a mask wherever they were going inside. That would be the perfect world. I think that's what the doctors are saying. It's really important for now to do that. And all we can do is encourage it and send some strong signals where it's required. But I just want to make sure I was clear on what Commissioner Seal was saying regarding the patrons and when they should wear it or where they should wear it. That was my only question. Thank you.
Commissioner Seal.
Okay, sorry. Again, I think we need to keep it simple, and I would defer to the sheriff for his advice or to Jewel for her legal advice. They're both attorneys and they know how we should practically, with common sense, draft this. I think it should be for anyone who's in an indoor space. It just makes it simple. If you are an employee there, that you need to wear a mask. If you are a patron going into a space, how do you define? Walmarts have grocery stores. So, if you go into a Walmart and you're in the grocery section, is that where you wear a mask? And then in the rest of the store, you don't? I mean, we're going to end up cutting hairs and, not having something that's easy for people to understand. So again, I kind of would defer to the sheriff and to Jewel and to the county administrator to set up something that's practical with common sense.
And if I can add to that, we do need time to draft this, because even the part about the alcohol establishments, we need to get and be very specific in the type of license. And so we do need a little bit of research to be able to draft the ordinance, as we've outlined here.
So do we need? Go ahead.
Are you all talking about offices? So what about law offices, real estate offices, professional offices? Or are we only talking about here? Because I'm not clear. Are we only talking about what I'll call public lack of, I don't know how, terms are a problem. Retail space.
Retail.
Spaces where customers interact for the purchase of goods or something. Are you talking about, every, manufacturing business? Because that's going to get a lot of pushback. If you're trying to get into, what employers do in their own environment. Because I tell you why I say that, because I know, because we've been down this route, our phones are going to blow up. So if you're trying to regulate it in any place that has, quote, a roof over it, and you're going to have certain employers that are just going to say, look, I'm not doing it, or we can socially distance, or whatever it is. If you're covering it, our phones are going to blow up over that. And so, we need to be really clear about, what you're talking about here, in that regard.
So would it be possible for the three of you to get together between now and Tuesday to come up with something that makes sense?
Good idea.
I mean, I think we can go round and round for the rest of the day on this.
We can. We actually got together to draft the first piece that I outlined there. The question, to the sheriff's point, is how far do we want to go with requiring masks in indoor places? Is it just for retail and restaurant type facilities? Is it for, like, to the sheriff's point, there's a lot of businesses that do have customers. You could have a manufacturing facility where customers come in, or something to that effect, and those are the types of questions that we're going to get. Sheriff's point's well taken. We sat every night, as you well know, and tried to define how something that we never thought of fits into the order for 2 months, and it's very, very difficult. That's a concern, and so the tighter we can make that, the clarity you can provide in terms of what you're looking for, the easier it'll be for us to draft something for you that meets that intent.
Right. And we don't have time for you to work on it for a week. Commissioner Peters?
Yeah, so when we started this meeting, the sheriff said the problem was nightclubs and young people and big gatherings. And his recommendation, I think, was limiting it to 50. Then we seem to have gone on a tangent to put masks on everybody. And I still haven't heard, are we putting masks on toddlers? Are we putting masks on children? How are we going to mandate that every person has a mask? And I know Commissioner Welch doesn't seem to agree with my doctor. And she says if you touch your face mask, you cannot touch your nose, your eyes, your mouth. And if your mask gets sweaty, and the doctors on this thing have said, if it gets wet and it gets sweaty, that is a compromised mask and it could make you sick. So how are we going to deal with that? And I do want to know about the children now. And how do you know, and how do you prove that they have a breathing problem? So two of my grandchildren have asthma, and wearing a mask, I'm going to assume, I'm not a doctor, may cause breathing problems. So we're going to put masks on an 8-year-old with asthma. And so these are things I have questions for, and we haven't talked about, is it everybody? Is it children? Is it infants? Is it toddlers? Is it 3-year-olds? And how are we going to keep it on 3-year-olds' faces? When in the restaurant can you take your mask off? When the food is in front of you, or when you want to drink, or when are we doing that? And we started this with, the problem was young people in big groups. And so the problem is young people in big groups, but we're making the solution everybody, including, I'm assuming now, children and toddlers. And so I want clarity on that. Civil, sure, that's what we're going to do. I definitely would not want a criminal record because someone chose not to wear a mask, or their tie broke, or it got so dirty, or fell in a puddle, or was really sweaty and they had to take it off. I don't even know that civil is right to be doing that. So I still have big concerns. You all know that I've made that clear. But I want to know, are children included in this? And how do we say, I've got a breathing problem, so I'm not wearing it, but how do we prove that you have a breathing problem? Do we all have to carry a note from our doctor saying I have asthma, or I have a breathing problem, and my doctor said I don't have to wear one? How do we do that? And so those are details I want to see before we do any kind of vote. And I wouldn't support letting the administrator do something without us reading it and voting on it personally. So those are just my comments.
Thank you. Commissioner Eggers?
Well, yeah, I don't have any, I certainly don't want the county administrator to do anything on his own. So Barry, you're relieved. You don't have to do that on your own. You get to bring it back. You get to bring it back to us.
Absolutely agree.
So that's a good thing. And to Commissioner Peters' point, there are going to be a list of probably 100 things that if you sit here long enough, we could come up with exceptions as to where it breaks down. And we've gone down that road before. There's clearly ways where this will break down, and you can argue your way out of all of it. And so we go full circle again and get back to where we are today and what is coming. Again, the doctors are telling us too that they're concerned, this exponential growth, which is different than just normal growth. And again, I know it's only been for a week or 10 days, but we still haven't seen the effects of other things that have happened. Phase 2 opening up and the protesting. So I guess we could do nothing and expect nothing to change and nothing to get worse. And it seems like that would be putting our head in the sand. So here we are trying to come up with something that supports our businesses that want our support, that support people who are scared to death about going in and getting some food from the grocery store. Again, we're going to split hairs. Then it says grocery store, Publix. That's it. Walmart that's open. That would be different. Now, according to Commissioner Seal's proposal, it's not different. They're all indoor activities and it's retail. I think it's retail. We're not talking about the other offices. We're not talking about manufacturing facilities. But Sheriff, I did want your thoughts on this and everybody, I guess. I think we almost ought to make it like you can't, as a business owner of a office of a manufacturing, mandate people not to wear masks. And I don't know how, again, I don't know how you enforce that, but if people are being told, like at maybe a hotel or something, you do not wear masks, to me, that's a problem. That's almost a personal right that somebody has to wear a mask if they choose to. So I don't want to, I think what we're talking about today is retail things, constant interaction with the public, selling of goods. That's kind of where we're heading. But I just, on the other part where we're not talking about, I don't want people, if they go there and they're nervous about the social distancing and they're nervous about, and they want to wear a mask for security or whatever they want to wear a mask for, I think they ought to be able to do it. That's just a separate thought. So thank you.
Me too. I think that should be against the law. Commissioner Seal.
I guess this is, I want to respond to Commissioner Peters. I did not expect to have them put on children. However, we define that age as kind of tricky. Is it 6-year-old? Is it like Monroe County did? Is it toddlers? I'll leave that up to the medical experts to help to make that definition. I do believe that the St. Pete ordinance has some exceptions that are very practical and very full of common sense. They address ADA, they address that it doesn't apply while eating or drinking. If it's incompatible with a job task performed, like I said, hearing impaired's covered. If they have trouble breathing, they don't have to carry proof that they have a medical condition. So we can do this with common sense. And so again, I will leave it up to the sheriff, to the medical, to Barry, to Jewel, to come up with something that's practical. So thank you all.
I think common sense is getting rarer and rarer. Commissioner Welch.
So I've been around Commissioner Seal way too long, like an old married couple. You see, I just wrote down exactly what she said, practical and common sense. I mean, we can come up with 1,000 reasons why this might not work, but it's not going to change the need that's in front of us. So I'm looking forward to Jewel and Barry coming back with kind of a synthesis of what we talked about today. And I did want to mention that the Monroe County did have an exclusion for children under 6. And it says under 2 when you get into the detail, but they do have an exclusion. And they're just common sense things that are in the St. Pete order as well. But I strongly think we need to move forward with this. I think we got a lot of good input. moving to civil, but I think including all business establishments is where we need to go. And that's what I'll be supporting when it comes back. Thank you.
Okay, great. So in order to enforce what's already in place, we don't need to do anything today, right? The 50 people in a bar, etc. Can we just assume that that will be enforced this weekend? And
Well, the current regulations say that restaurants are 75% capacity, bars are 50% capacity. And so from that standpoint, the 50% capacity can be enforced now. And the problem gets not the 50 people. 50 people is not 50% of capacity necessarily. Depends on the establishment. So we were actually talking about having that defined 50 people, which would probably, if you look at 50% capacity, they may be in compliance. It just so happens in a big establishment, they're all in 100 square feet in front of the band, by the stage. So I would want that to be part of the change that we'll bring back to you. However, there are provisions within the current law that we could work to enforce. And I know the sheriff has. We had an example of someone down on the weekend and they were not being responsible. And they followed back up and they went and talked to the owner. And they said, no, this is not going to work. So they are going to take steps like that. I'll let the sheriff speak for himself, but there are provisions that we would want to tighten up as part of this change.
But at the crux of this, who needs to be responsible for this? Are the business owners. The business owners are the ones that need to be responsible for this.
Right.
Business owners are the ones that should, need, want to be open. We want them to flourish. We want them to prosper. But the problem is there's a whole bunch of them that are not gatekeeping this themselves. And get to your question, Commissioner Gerard, so there's no misunderstanding. When it happens this weekend, and insert name of bar here, location here, and they've already allowed 300 people in there, and I get these buku photos sent to me. Oh my God, there's 300 people in this establishment. Come do something about it. I'm not doing something about it because I'm not getting in fights with these people. We're not using force. We're not trying to break up a bunch of drunks and trying to ferret it out. It's a solvable problem. It's very easy. They know what 50% of their capacity is. They need to put somebody at the door. And when 50% is reached, stop letting people in. That's how it needs to get enforced. That's how this problem is solved. Now, because once the bell is rung, it is impossible to unring it. It's just like the beaches. We didn't let people get out there to begin with. If we allowed 5,000 people on the beaches, we're not going to get 4,500 people out. So we didn't let them in to begin with. That's how this needs to be accomplished today, tomorrow, and moving forward. Now, it is easier if you have a set number, and that's what we talked about, as opposed to 50% of capacity, because who knows what that is? You got to go look at the license, and you got to do this 50% thing. If you just say, okay, 50 people, then you can count heads. And if it's a low number, it's easy. But once you get 300, 400, 500 people in a place, we're not going in and doing it. Now, on the backside, we will, like we did this weekend, is that we went out and talked to the management and said, look, you need to own this. You need to be responsible for this. You need to, but they're the ones that are dropping the ball here because they're the ones that are not self-regulating. And, if they don't want these restrictions and they don't want greater restrictions, then they can solve the problem. But they're not solving the problem themselves, and they're exacerbating the problem by allowing it. And this is what's causing this. Again, some self-responsibility as far as how these things are operating would go a long way.
Oh, absolutely, I agree. But so what do we do to make them comply? Because that's the problem. I mean, so there are a lot of little hole-in-the-wall bars here that probably can't even hold 100 people. Let alone, I mean, do we do anything with them?
I don't necessarily frequent the hole-in-the-wall bars, but
I don't either. But
is that they're not the problem? Okay, the neighborhood pub or the neighborhood bar where you got, 6 or 7 people in there, and from what I can tell, and see, they're not the problem, and they are compliant. It's the big ones. It's the ones that are just opening the doors, floodgates, everybody come, and you got some pesky little rules, and we're just not going to follow. That's what we're seeing, and whether it's a lot of it's on the beaches, but it's not. It's Clearwater Beach, it's St. Pete Beach, it's up and down those places. It's in other parts. It's in downtown St. Pete. We saw some of this. So, those are the big things. I would suggest look at the low-hanging fruit, the big chunks, the things that are going to make a difference. Don't worry about the mom and pop little establishment, whether they have 9 people or 11 people. Those aren't the problems. You can't do this in getting into the minutia and the details. Don't let get in the way of good. Get as good a place as you possibly can, because we're never going to hit a home run with all of this. And I think that's what we've learned. That's what I've learned over the last 4 months. But look at the big things that are going to make the biggest differences, and those are the big establishments.
So is that something that we can legislate?
Well, we will, and we'll bring that back. So we'll limit those again under that certain type of license to 50 people.
Okay.
Because if you get 300 people in there, they don't have food, so they're not going to be at a table. There's going to be a problem. Okay, we know that. We know that if you're serving people and they're not at a table, then they're congregating in large crowds. We know that. So there's things that we can do, and we will tighten that up. That'll be part of what we bring back to you. But I think the message's got to be real clear. A lot of these businesses, they know. We didn't say the names, but they know who they are, and we know who they are, and and so we're not going to stand to let that continue. The sheriff, him and I have talked about this repeatedly. We know it's a problem and it's got to be addressed, but he's exactly right. These bar owners have to be responsible, or we're going to take additional action. I think that's got to be the clear message coming out today. We don't want to make it across the board. We want to do this strategically and where the real problem is, and that is a problem, and we know it. And so we've got to take action on that.
So are we prepared to do something like that today, or do we need to wait till Tuesday?
I need to work with Joel on the drafting the ordinance, because I really need to get specific into the type of liquor license.
Okay. Commissioner Eggers, did you have your hand up?
Yeah, I did. I want to make sure I'm clear, because I've heard a couple different things. One, you're going to work on something and bring it back to us around the concept of retail exchange of, or is it all inside? For me, I'm comfortable with the retail where you have constant interaction with patrons and people are at risk all the time. To me, that's where I was going. And I heard one person mention a fine earlier, and for me, I agree with the civil thing. Let's just it's no criminal penalty for this, but I haven't heard, Sheriff, what are your thoughts on, going to that place that you're talking about, or those 5 places that you're talking about, and you see it and you hit them with a $500 ticket. You come back the next night and they do it again. You hit them with another 500. To me, business owners understand penalty. I mean, I don't know how else, if we don't do that, if we don't do something like that, and again, you're not arresting them, you're not doing any of that stuff. Mm-hmm. You're encouraging them, do the right thing. We're not going to do fines this weekend, although we could, but we're coming with fines, guys. If you're going to go against what we're telling you, it's finable. Your thoughts on that, Sheriff?
Yeah, I think that makes sense for those. You tell them, and then you tell, but we haven't had that option up to this point. The option that's on the table right now and has been is nothing else. It's criminal or nothing. So it's a matter of going in and arresting somebody, issuing them a notice to appear, giving somebody a criminal record. And again, it needs to be as delineated, as clear, and as black and white. That's why I suggested don't use this percentage, use specific numbers. It's real easy. Okay, the max number is 50. We count, there's 60. You've been told 4 times about this. Here's a civil ordinance violation. The first time is $500, second time is $1,000, third time is $1,500. And I would say to others too, is that peer pressure goes a long way. And to all the businesses that are operating out there, to the colleagues that you have, okay, that are just not doing what they need to do in the name of getting bodies in the door and making money, is that get them to stop because they're hurting everybody. They're hurting you. And so, no, Commissioner, I think that is especially it relates to these that are just grossly violating it, and having these 400 or 500 people, having these huge groups, just totally not making any effort at all, is that, and I'd be receptive to enforcing it against the business. I really think that the businesses should own this. The businesses are the ones who should be responsible. They can fix this. And if they would step up and do it, then a lot of this would take care of itself. So, but if you gave us the option of a civil violation under a civil ordinance to issue ordinance violations as to the businesses, I'd more have to do that as opposed to the individuals, because the individuals can't do this if the businesses don't allow it.
Right.
Don't open their doors and say everybody flood in, then those people aren't going to be there. Those people are coming because they're allowed to be there. It needs to be gated. Businesses.
Commissioner Seal.
I'm going to change the subject for a second, but it goes back to Dr. Snow. I've been receiving a lot of texts from someone who went to a veterinary facility, and someone did have COVID, and so they contacted, I guess, everybody who'd been to the clinic that day, but they didn't end up closing right away. I'd like to see in writing, just so in case people ask us, what are the procedures for if somebody does identify COVID at their business? What steps do they take? Who do they call? How do they do contact tracing themselves? What are the policies that you have at the Department of Health that, and finally, you mentioned it's a voluntary closure. If this becomes widespread and it's at a major retailer, it becomes a big, 10 people, 20 people, do they have to close? I mean, I don't know that answer. So whatever you could provide to us in writing, I'd really appreciate. Thank you.
No problem.
Yeah, and I would agree with that. I just found out this morning that I had someone in my home last weekend that now has COVID. So thank you very much. So I don't even go anywhere. Right? So I think it would be great if we could have some general instructions for individuals. What do you do if, just so we can send out to people, I just had contact with somebody, what am I supposed to do? I think that would be really great. Yes, Commissioner Peters.
Thanks. And if you're going to go on that road, I recommend, there's other things out there that are going to get messy about noses sticking out. What does that mean? But I would put in there because I think you'll have people show up at bars, like, I don't know if you can see me with their mask hanging on their ear like this, and they can say, I am wearing a mask.
Right.
So if you're going to put language in there, you might want to make sure it says face covering versus wearing a mask, only because I think you'll get that. So my other question is not on this issue, but it is on this issue. Last week, I suggested we don't do the in-person meeting. The numbers hadn't spiked to 12%. Are we still looking at doing an in-person meeting next week, given that the numbers are spiking and we may have a lot of people show up, we may not have a lot of people show up, we're going to mandate masks. Would it not be better and another message if we continue on the Zoom meetings by not doing it in person? So granted, I know notices stuff last week would have been a more timely notice, but are we still meeting in person given the spike in numbers?
If at this point you all were to want to change to a virtual meeting, we would need to defer anything on your public hearing agenda, because those have a legal notice required to go along with them, and they have been noticed for the Magnolia Room, both at an in-person and virtual meeting. If you wanted to entertain the thought of having a virtual meeting for your regular business meeting on the 23rd, I think you could probably attend to all of your normal business items that day, but the public hearing agenda would have to be deferred.
Do we have anything on there that is going to seriously disrupt somebody if we don't do it on Tuesday?
And I bring it up specifically since Pat Gerard just said she had someone in her home that was positive. If she's in that meeting, does that put us at risk? I think it's the 14 days. It might be, might not be.
Right.
We, at the Magnolia Room, we do have social distancing. So you do have separation, and we will have masks available for everybody. You do have some public hearings, one of which at least is kind of controversial. We've been putting.
Are we ready to move on? Or would we like to take a lunch break before we do, okay,
A lunch break.
a lunch break? How about if we come back at 12:30?
Yes, ma'am.
All righty, thank you.
Oh, good.
Brian, I think you need to work on some sound effects. Little buzzes, bells.
I can do that. Wake everybody up.
Maybe, you know, someone says something funny. I think.
We're doing agenda review.
Agenda review. Now, this will change as a result of doing agenda review. I mean, because this will not be in, it'll be a virtual meeting. Do you want the citizen, the public comment?
Yeah, I think so. I think
Okay.
we need to start doing those again.
I'll put it back on.
Thank you.
So we'll have the public comment, items 2 through 19, but I'll just go through them. So 2 through 6 are just minutes and vouchers, receipt for filing, miscellaneous receipt for filing. Item 9 is an award of a bid to a commercial landscape professionals. This is for various things in our administrative services in our facilities department. And the contract, though, will be managed by the Parks and Conservation Resources Department. The next is an award of bid, and I can't even pronounce that name, for intersection improvements. This consists of roadway traffic, pedestrian intersection improvements on 131st Street. $5.6 million. The next is an award of a bid to RJP Enterprises for guardrail repair services. Item 12 is a joint project agreement with the City of Pinellas Park for drainage and roadway design, proposed design services, construction of a culvert replacement and channel improvements at 102nd Avenue North over the Cross Bay Canal. Item 13 is an award of bids to Heinz Electric for South Cross Bio Advanced Water Reclamation lighting upgrades. Item 14 is an award of bid to Harris McBurney Company for Forest Main Air Release Valve Replacement Project at 54th Avenue in St. Petersburg. Item 15 is a joint project agreement with the City of Bel Air Bluffs for construction and relocation of a county water distribution main and gravity sewer mains in conjunction with the city's roadway construction and drainage improvement projects along Dolphin Drive and Mellenbacher Road to South Winds Drive. Questions? Item 16 is ranking of firms with McKim and Creed for professional engineering services for the supervisor control and data acquisition systems master plan update. This is our SCADA system.
17 is a new lawsuit. This is a negligent case arising out of an auto accident. 18 is a case that we have already discussed. It's just something on your agenda because of timing. This is a lawsuit that has already been disposed of. We were dismissed with prejudice, and we've already talked about this one, COVID related. 19 is another negligence case. This is the result of a slip and fall.
Item 20 will be the state of emergency for the following week. Item 21 is a contract for sale and purchase with Habitat of Humanity for the sale of 27 vacant parcels located in the Dansville neighborhood. Item 22 is an agreement with Southern Flogger detention equipment for the county's jail F-wing sliding door retrofit program. Commissioners, I'm requesting we remove item 23. This is the phase 2 of the CARES Act program. To provide just a brief update, we did a big public outreach. First we talked to community leaders from throughout Pinellas County. We then did a community survey. We had an online just chat with community members. We received a lot of input. We then met a couple days ago with those community leaders and refined our program. We're very close on the program, but since we have to meet on the 30th to extend our local state of emergency, that would give us an additional week to continue to refine that plan. We just want to make sure it's right. We want to make sure that it hits all of the pertinent areas, and so there's some cleanup I'd rather spend doing that prior to presenting it to you on Tuesday. I would just be rushing it a little bit.
Okay.
Item 24 is a resolution expressing support with Beckwith Electric as a qualified applicant for the economic development ad valorem tax exemption. Item 25 is an agreement with the Florida Department of Children and Families for the Criminal Justice, Mental Health, Substance Misuse, and Reinvestment Grant. This award would be $400,000 for 3 years.
Barry, you've got a question from Commissioner Seal.
Oh, sorry, Commissioner Seal.
Sorry, on item 24, this is for Jewel. I'll probably have to file a form to recuse myself. My husband does business with this company. Thank you.
Item number 26, issuance of certificate of public convenience and necessity for of helicopter ambulance service here in the county. Item 27 is a third amendment to an agreement with, Intro Dodd Life Safety for Next Generation 911. So this is a third amendment on this agreement. This is out at our 911 center. Item 28 is a second amendment to the agreement with Covanta Projects for the waste energy facility. Second amendment adds 9 new boiler tube projects. This is all in with the master plan that was previously presented to you. Item number 29 is a second amendment to a consent order between County South Cross Bayou Advanced Reclamation Facility and the Florida Department of Environmental Protection. This is when we lost power, and so this was stipulated agreements and penalties during that time period. Item 30 is with Career Source Pinellas. Actually, item 30, 31, and 32, actually, and 33.
33 and 34.
Oh, and 34. So, if there's any questions regarding those? And 35 is a fourth amendment with Paramedics Logistics Florida for the requirements for ambulance services. $36 is a budget amendment for the Supervisor of Elections. This is what we discussed during her budget, is to provide things for the primaries for this year.
Under 37, this is a confidential item. As with the others in the past, I will be giving each of you a call before Tuesday to talk about this case and staff's recommendation. 38 is a request to initiate litigation. This is a case of housing discrimination that was investigated by your Office of Human Rights, and we will be seeking authority to file suit. Under 39, this is also a request to file a lawsuit. This is a ordinance violation situation where the owner has been given an opportunity to come into compliance and has not. So we will be asking your authority to seek an injunction. And on 40, this is something that I've brought to you in the past. We bring it to you about every 4 years. This is a request from the school board to place their referendum question on the general election ballot. This would be to continue the 1/2 mil levy that they have had in place for some time. I have spoken with my contact at the school board and asked that they have somebody available for your meeting in case any of you have any questions on this item. And I currently have nothing planned for 41.
I will have a county administrator's report. Item 43 is an appointment to the Solid Waste Technical Management Committee. And you have multiple applicants for consideration. And then finally, 44 is a request for Palm Harbor Community Services Agency MSTU request by Commissioner Eggers.
Okay.
The remaining items are the public hearings, which we will postpone. We will have to have them on the agenda, and we'll have to make an announcement that they have been postponed to the July meeting or to a future meeting.
Okay. All right. Next, now we're going into budget session.
Next up is animal services. And so animal services, there I see Doug, who is the budget analyst for this. I don't have these names down.
Let me see. We should have Frederica Collins, Doug Brightwell, and Kristen Kerr. And I think we should have.
Frederica's up.
Good morning.
Good morning.
Sorry, I'm just getting this ready here. Sorry, Kristen, could you share the screen? For some reason, I'm having some technical difficulties here. It's not expanding.
Yes, ma'am.
Actually, I have it.
You got it?
Sorry about that. Yep.
Okay.
Okay, so good morning, everyone. My name is Frederica Collins from OMB, and today I will be presenting the FY21 budget for animal services. Joining me today is Kristen Kerr to share the performance and work plan items, and the department director, Doug Brightwell. Kristen, I'm going to turn it over to you to jump into the performance.
Thank you. Good afternoon, commissioners. Thank you for your time. As Frederica mentioned, my name is Kristen Kerr, and I'm the Strategic Performance Management Analyst for Animal Services. Working with this team has been a pleasure over the last year, especially when I'm visiting our adoptable animals in the shelter. Animal Services established performance measures over 3 years ago that are tracked monthly. During these last 3 years, Animal Services has seen an increase in life-saving outcome measures with a reduction in euthanasia of shelter animals. As Animal Services migrates their performance data into Excella, we will assess trends from the last 3 years and establish targets for their outcome-driven measures next fiscal year. Currently, the Office of Technology and Innovation is working with Animal Services to build requirements to transition their data from PedPoint to Excella. They have begun to meet weekly with Animal Services subject matter experts to transition this data and make it easier for reporting. This initiative is included in the section below Opportunities for Efficiencies, which upon completion and implementation of this project, it is anticipated to improve field service activities and increase future revenue growth from the rabies licensing program. Lastly, in this current fiscal year, Animal Services has finished remodeling their new cat adoption room, so visitors have more space to have meet and greets with adoptable cats, and it provides more space for the cats to roam around. In response to COVID-19, Animal Services shifted their work schedule to ensure the department was abiding by CDC social distancing guidelines, with most staff working 12-hour schedules. Starting in late March, Animal Services suspended in-person volunteer services through May, and foster families, though, however, continue to support the department. Overall, the department has seen an average monthly decrease in volunteer hours by 44% during this time, which is a monetary equivalent value of $51,406. Animal Services has also had low counts of sheltered pets during this time as they have seen consistency in adoptions. Additionally, Animal Services suspended rabies vaccinations for citizens in April and offered a 90-day extension for those individuals who have had pets due for vaccinations. Staff is modifying on-site rabies clinic procedures with COVID-19 guidelines in mind and plan to restart this service in July. That's all that I have for performance impacts, and I will now hand it back over to Frederica to discuss their fiscal year 21 budget.
And Frederica, just FYI, we lost the visual. I'm not sure whether you stopped sharing.
Get it back up here.
Frederica, I can take back over so you can present.
Perfect. So as you can see, I'll wait till she get that back on the screen here. So for FY21, Animal Services did not propose any decision packages for this year's budget request.
Sorry.
Okay, perfect. So for FY21, Animal Services did not include any decision package in the FY21 request. And although the immediate impacts of COVID-19 have been mostly limited to adjustments to day-to-day operations, the long-term economic impacts of COVID-19, such as sustained unemployment at this level, evictions and foreclosures, will cause an increase in animal intake and potentially a reduction in adoptions. Continuing on to the budget summary, Animal Services is supported by two funds, and it is reflected in the tables below. The general fund, which is table 1, is the primary source of funding for the department's activities. The budget from FY20 to FY21 remained pretty consistent with minimal change. There's actually some reductions that I'll dig into a little bit further when I go into the budget. And then the Gifts for Animal Welfare Trust Fund, table 2, supports the special needs of animals and is supported by private contributions. The third table below is actually just a summary of both of those funds combined, so you can kind of see the true impacts there. For the staffing summary, over the past 5 years, Animal Services has maintained 58 FTE. This represents 57 full-time positions and 2 part-time positions. The budget projection for the upcoming fiscal year is to maintain the current service levels while reducing the budgets to align with historical trends and the current department needs. Just to expand on the expenditures, the overall Animal Services fiscal year 21 budget reflects an increase of $3,000 over the FY20 adopted budget. Specifically for the general fund, the total expenditures for Animal Services reflect a decrease of $83,000 or 1.4%. Personnel Services reflects a net decrease of $119,000, and this is consistent with the anticipated increase for personnel. And as I mentioned a little earlier, staffing levels remain consistent from FY20 to FY21. Operating expenditures reflect a net decrease of $66,790 or 4.7%. In the past, Animal Services contracted with a temporary staffing service to support veterinary operations during peak times. This is now supported using existing resources by adjusting staff schedules to accommodate. Postage fees increased. This is primarily to maintain compliance since Animal Services sends up to 3 notices for non-compliant pet owners. The department attempts to offset these costs by having their animal control officers, ACOs, hand deliver notices when possible. When the implementation of ACELA is completed, Animal Services will explore options to streamline this process to hopefully minimize some of those costs. The intergovernmental risk decreased due to reduced vehicle incident claims and by reinforcing safety among their staff. And then operating supplies, operating medical, operating food, and costs associated with those decreased to align with all of the historical trends and also to align with the current shelter needs for the department. Capital outlay reflects a net decrease of $135,370 or 98.1%. This is primarily due to in FY21, Animal Services received approval for a one-time decision package for 2 animal control officers to improve response times throughout the county. Another reason is that the department completed shelter renovations to relocate the cat adoption room to allow better interaction with the cats, as Kristen mentioned earlier, and to also relocate the accounting office to expand the workspace for staff. Moving on to the Gifts for Welfare Trust Fund expenditures, excluding reserves, the total expenditures for the trust fund reflects a decrease of $162,230, or 55.85%. For personnel, staffing remained consistent at 1 FTE, and this FTE funds 1 full-time grant worker position. Operating expenditures had a minimal decrease of $160. This was due primarily just to some minor adjustments with the risk allocation. The capital outlay reflects no budget for FY21, which is a decrease of $105,000. In FY20, the department planned for shelter renovations with the purchase of large kennel fans and changes to the shelter facility layout. For grants and aids, this reflects a decrease of $60,000, or 77.9%. In order for the department to fund the capital outlay, in FY20, Animal Services reduced the animal community grants allocation to address facility needs. The community grants program will continue in FY21, providing reimbursement grants for nonprofit agencies to provide service that benefits the animals of Pinellas. These services include preventive care, sterilization, and TMVR up to $5,000 each. An additional $2,000 has been allocated for pet houses for low-income pet owners, and that is provided on a first-come, first-served basis. Reserves show an increase of $254,230, or 92.9%, and this is primarily due to reduced spending. In FY21, the department plans to reassess the goals of the trust fund and how funds are spent to ensure that the best level of care and resources are available for our furry friends. The COVID-19 impacts on expenditures have been minimal for Animal Services. Operating expenses for the FY20 estimate are projected to be consistent with the FY20 adopted budget. The costs associated with increased sanitation measures, PPE, and employee social distancing requirements have minimal impact on the department budget because these costs are offset by reduced spending in other program areas for standard operating costs due to lower shelter intake and also increased adoptions. The department anticipates this will be the same for FY21. There has been a slight shift. On June 1st, the department did resume intake of stray cats and has not been able to quantify the impacts that this may have on operations. So far, all of our projections for FY20 are still consistent with the numbers that we have submitted. Moving on to revenues. So the revenues for Animal Services are forecasted to generate $3.6 million. This is consistent with the FY20 adopted budget. The general fund reflected in table 4 reflects a $3.5 million in anticipated revenues, and this is primarily due to the rabies licensing program. The trust fund, which is table 5, reflects an $80,000 approximate in anticipated revenues from citizen and pet store contributions. One thing specifically I wanted to point out with the trust fund, and when you look at the trends there and it looks like, you know, the numbers are going down or that there was a huge contribution to FY17, the Animal Services Trust Fund received a generous donation that year of over $220,000 from a private donor, which is the cause for that spike in FY17. For subsequent years after that, it's just primarily based on just standard donations that we receive through the kiosk at pet stores and just anything that comes in from citizens in the shelter. For the COVID-19 impacts on revenue, the impacts from COVID-19 are minimal. The general fund revenues that result from service fees have remained stable and are consistent with the FY20 requests. Animal Services has been able to minimize the impacts of COVID-19 on revenues with community engagement, website, updating all of their information and emailing to ensure that the citizens understand that current rabies vaccinations and licenses are still required. The trust fund experienced a decrease in donations, as I mentioned a moment ago, but it is expected to return to normal as services continue to resume. For the user fees, Animal Services proposes various changes to service fee charges to align with informal surveying of peer counties. The total impact of these charges is an increase of approximately $50,000. Each year, as part of the budget formulation process, Animal Services does a great job at reviewing all of their user fees and making gradual changes each year to minimize the impact to our citizens. I want to thank you for your time, and I will now turn it over to Doug to expound on the proposed budget and to further explain how Animal Services is supporting the county and its citizens. Thank you.
Good afternoon, Commissioners and Administrator. Thank you for your time today. I want to mention one thing on our user fees. Kristen, can you bring that back up? Yes, Commissioner Seal. If you'll look on the top of the page where we have the licensing section, we have a user fee, an incentive proposed for next fiscal year, and that is an initiative we're starting with the veterinarians, hopefully, so that when we move to Excella, we currently pay a third-party data entry by the license for data entry, and by giving an incentive to the veterinarians to enter their own data online, we expect to increase the efficiency of the database by getting the data in live instead of having a 3 to 4 week lag time. And we expect to have a significant cost savings for the county because this incentive would be significantly less per license issued than what we're paying the data entry service currently. Then other than that, I just want to move on to the issues we had with COVID. We were able to deploy our continuing operations plan and work split shifts to keep our staff and services open for the public during the isolation and the Manatee County shutdown. We provided a lot of essential services. We're now back online with almost all of our regular services as well. We've learned a lot of lessons about how to do business differently and how to do business better that we're going to continue to deploy long term, specifically with like our rabies vaccinations and kind of how our workflow is working within the shelter. And so I wanted to appreciate all your time, and if you have any questions, I'm ready.
Yeah, Doug, I have a question.
Yes, ma'am.
Some time ago, I met with one of the partner agencies that you work with, and it came up that they could really use a little bit more subsidy from Animal Services, that they do a lot of work for us for a very little amount of money. And I'm just wondering if there's some way to increase that reimbursement amount.
Well, we're not doing any this fiscal year because we deployed those funds over to getting our cat adoption room enlarged and the new cages for that area. When we redeploy that program in fiscal year 21, we will look at the market rate and then make the determination on how that model will deploy based on the current market factors for fiscal year 21. We try to be sensitive to what the cost of doing business to perform those surgeries and get those vaccines and make sure that we're trying to be fair with that reimbursement.
Okay. Hey, and by the way, you're supposed to bring cute, fuzzy pictures with you when you come. So.
Well, we normally do, but we are out of puppies and kittens both right now, which has been a wonderful positive side effect of the COVID-19.
Yeah, that is great, actually. Commissioner Seal?
Yes, I thank you, Commissioner Gerard. You started the questioning where I was kind of going to go. So we have for the Gifts for Welfare Trust Fund, what is unclear to me is how much revenue do we generate? I can find expenditures, but I don't know how much revenue we generate in a fiscal year.
That was on, let me see, table. Kristen, if you could pull it back up.
Yes, and
table
on
5.
average for the trust fund, I can show you here.
We bring in usually just enough revenue from the pet store donations and the kiosks to cover the one grant worker that we have that full-time takes care of the maintenance of bringing the cats to the pet stores for the adoption program, which we would not be able to get the cats adopted out like we do if we did not have that program. We do get some supplemental donations from the public. So that's why we try to be very cautious with how we spend, because if we spend more than we bring in, we will quickly deplete the welfare trust fund. And as you can see from table 4 right there, we normally average between $85,000 and $100,000, just under $100,000 per fiscal year. And last year with $80,000 was lowest because the fewer cats we have going out to the pet stores, it does reduce our donation fee amount coming back in.
Okay, that gives a lot more clarity. I was trying, when you have the revenues go to table 5.
And
Revenues,
that's the revenue.
rent surplus and refunds is kind of confusing.
Yes.
Right. So I noticed also, and that provides clarity to what the grant writer does, that she is actually producing income by getting these cats adopted. That's great. And so then my question on the grant and aid, which Commissioner Gerard started asking, we budgeted only $17,000 for the next fiscal year, with each not-for-profit can't receive more than $5,000 in reimbursement. I too have an issue. We have a not-for-profit that we ask that they start doing business and support this program for TNVR, and to only give them $5,000 up to $5,000 a year is minuscule for the work that they are doing in our behalf.
Well, but
a whole lot less cost.
But none of the nonprofits are doing services directly for us, because none of the animals they are providing services for ever come through animal services. Those are animals that belong to the folks in the general public, not with us.
I recognize that, but they are diverting those cats from our animal shelter, and that's a big deal. And they're helping our euthanasia rate greatly. So I believe that we should be trying to support them more monetarily.
Yes, ma'am.
Great. Thank you. Anything else for animal services? Okay. Next year pictures then.
Yes, ma'am. I'll do it.
All right.
Thank you.
Okay.
Thank you.
Next issue, emergency management. Oh, they've had a busy year.
Lisa Burley's up.
Thank you. Good morning, commissioners. I would like to introduce my fellow co-workers and the emergency management director. Kathy Perkins is the director. Kristen Kerr is our SPM, or performance management specialist, and Frederica Collins, who just disappeared.
Oh, sorry. I didn't know Frederica was staying on. My bad.
That's okay. And we're here to talk about emergency management, and I will turn it over to Kristen. She's going to talk about the performance management portion along with the work plan. Thank you, Kristen.
Kristen, you're muted.
Thank you, Brian. Good afternoon, commissioners. Once again, I'm Kristen Kerr, and I work in the strategic performance management team. Working with emergency management has been quite an exciting time over this last year, especially these last several months. Prior to COVID-19 activation, emergency management updated their department strategic plan and performance measures during the first quarter of this fiscal year. In this process, emergency management focused their work plan initiatives and performance measures into 4 high-level objectives: engaging and empowering whole community partners, addressing at-risk communities, ensuring operational readiness, and promoting resilient communities. Additionally, from October to December, emergency management reassessed 35 shelter locations. This resulted in the identification of 9,670 additional shelter spaces. This allowed the county to move to larger spaces per person in each level of the storm. 2 additional steps.
Are you meaning? Yeah, is it? I'm not seeing it on the screen at all. I mean, I can follow it here, but if you're wanting people to follow it, it's not on the screen.
Lisa, would you like to share?
Sure.
Perfect, thank you. Thank you very much, Commissioner. In addition, 2 step-down sites were added to the list in both Palm Harbor CSA and the Coachman Service Center. Progress on this initiative can be found in the backup documentation. Transitioning into COVID-19 impacts, emergency management has shifted operations in March to respond to the current activation. Most of their regularly scheduled activities were canceled for 2 months, including training, exercises, planning meetings, outreach presentations, and the annual large events that they hold, including the Hurricane Preparedness Day and Hurricane Exercise. Despite these changes, emergency management has utilized technology to facilitate and coordinate with the community partners to respond during this activation. While some of their work plan initiatives were postponed, they were able to accelerate other work plan initiatives around increased coordination with partners who support vulnerable populations who are challenged by income, transportation, and housing. This was done through creating working groups, such as our homeless working group, community feeding, community well-being, and behavioral health working groups, who were instrumental in supporting our community and continue to support our community. Emergency management has also moved up previous set deadlines to update the public health emergency plan, which was previously known as the pandemic plan, and the points of dispensing plan, and is developing an after action plan to memorialize key activities that occurred thus far, and a plan for how to coordinate a community-wide approach when a vaccine becomes available and or a second wave of cases. This shift to respond to a disaster using a whole community approach will continue through hurricane season. As emergency management transitioned into recovery for COVID-19, they used this time to revise hurricane plans to include social distancing measures. The new plan will require more space per person in shelters, evacuation scenarios to reduce the number of people being asked to evacuate, updated outreach materials, and they've identified personal protective equipment for response and sheltering activities. Efforts to look at non-congregate sites to support COVID-19 positive evacuees are also underway. The Emergency Operations Center procedures are being reevaluated to include the number of personnel who need to be on site for feeding and bunking operations, and alternate locations are being coordinated to respond for response and recovery efforts. Emergency management continues to support operations and is working diligently to fulfill other work plan initiatives that were delayed due to COVID-19 activation. The Comprehensive Emergency Management Plan, which is usually referred to as CEMP, is required to be completed and submitted to the Florida Division of Emergency Management in the fall. A 90-day extension is allowable, but making this goal may present a challenge if there are any additional activations. Knowing Kathy and how her team operates, though, they will continue to work diligently to meet this deadline. As we move into operations for efficiency section, some recommendations are already in the works, which were mentioned in previous sections. To support an increase of shelter capacity in sites, emergency management will receive approximately $1.8 million from fiscal year 21 to 22. During Hurricane Irma, the county opened 16 shelters, which housed approximately 22,000 people. With a larger scale event or that of the same size, we will continue to reassess capacity and increase available space, especially now more than ever to maintain social distancing in our shelters. Emergency management continues to seek federal and state grant opportunities to supplement general fund dollars where possible, but does not have a dedicated grant or contract staff member. To help support this process, emergency management can and has been working with administrative services and purchasing and other county departments to identify and manage inventory of countywide disaster contracts. This will provide an opportunity to share contracts to improve coordination and reduce costs for services and access to available resources countywide. Emergency management is identifying an inventory management system for tracking disaster resources with the potential to link to Web EOC software to enhance reporting capabilities. We are currently looking at what county supported systems will be evaluated to help fill this need. There is also an opportunity to enhance volunteer tracking for both county and external volunteer groups to include essential information that will offset the 12.5% county cost share in the event of a federal disaster declaration. Finally, in addition to enhancing countywide coordination among both blue and gray sky days, emergency management has an opportunity to improve coordination with housing and community development, previously the planning department, the sustainability and resiliency officer, and the floodplain manager on land use, sustainable development, and the local mitigation strategy. While county departments prepare capital projects, it would be valuable to better align diverse projects across the departments and municipal entities to better utilize or leverage our penny funds to complete these projects. By identifying potential county mitigation projects through the project portfolio management process, we as a county can better be prepared to submit these requests when mitigation funds are made available. Before handing the presentation back to Lisa, I'd like to finish my portion by discussing potential threats. After the 2017 hurricane season, the Agency for Healthcare Administration required long-term healthcare facilities to develop emergency power plans to be reviewed by emergency management agencies across the state. It is unknown if AHCA may place any new requirement for plans that may fall under emergency management's purview due to COVID-19. This could increase plan review time for the department. The hourly rate is set by the state, so there isn't any way to increase these charges, fortunately. Finally, as emergency management moves forward into hurricane season, more space and non-congregate sheltering may be needed to reduce the spread of COVID-19. Emergency management continues to evaluate this need and will provide updates to county administration and the BCC as needed to address these threats. Thank you for your time again, and I will leave it back, and I will leave the presentation back to Lisa to discuss emergency management budget.
Thank you, Kristen. I'll go back up to the decision package. The decision package is a total of $310,000 request, and it is for 5 pod runners. And what those are basically portable operation centers that provide Wi-Fi communications, 800 megahertz radio communications, desktop, off-grid power. They're self-sufficient, much like a command center or a off-site EOC, if you will. There was a plan to have those set in different locations, and they have the plan set where the locations will be. It may be a staged plan to deploy them. And there's also 2 satellite pods, which will provide Wi-Fi and additional communication services. And that request is the only decision package request. I'll go into the budget summary. And as Kristen has mentioned several times, the emergency management is taking the whole community approach, and they're really reaching out with their community partners and building those and really trying to identify and reach the vulnerable population that they haven't been able to fully in the past, and help grow that. And she mentioned the volunteer program as well. The budget overall, when you look at the chart, move my finger so I can see, shows $2,102,900. We recently have been able to reduce that by 100,000, and that was moved to the decision package. So it really is $2,209,900. So you'll see a decrease in the next proposal. And one thing about this budget is it predominantly in the past was all emergency management. This year, they've split it out to EOC in order to have the ability to capture the cost for the Emergency Operations Center and the Citizens Information Center so that they could properly budget for that as well. So that's where you're going to see the increase, the way it's split out. Currently, $1,670,000 is in emergency management, which is about a 1.6% increase. Then you're going to see a 100% increase in the emergency operations, CIC, because they have not budgeted since 2018 when they purchased computers. So when you see that split out into the 2 cost centers, it's a minimal increase in emergency management, but a significant increase in EOC, mainly due to the mandated replacement of the thin client that they use in the EOC. I believe the computers have a 6 to 8 year lifespan, and we're in the 7th year, so it's very critical that those be replaced, and that was recommended by BTS. And then moving on to the staffing summary, you can see there hasn't been much movement since 2019. There's only been 2 positions in the last 2 years. One is currently vacant, but is intended to be filled. And let me move this other way. Here we have the total expenditures, and this is the entire the EOC and the emergency management has an increase of 372,000, but to note, only 39,200 of that is in emergency management. The remaining 332,800 is the replacement of the thin client and computers and various equipment that goes along with it to support the EOC and have continuity of operations in that area. Personal services had a minimal increase of 1%. Operating expenditures had a $27,000 increase, 10.8%. And that was predominantly based on the purchase of mill MREs or shelf-stable mills ready to eat, I believe it's referred to. And they are planning for a 3-year rotation of that so that it'll never be stagnant. And they're going to be working with Human Services so that prior to expiration, that they have the ability to deploy those into the community where there's great need rather than see them expire on the shelf if they're not used. And if they're not used, that might be a good thing. Also, the additional rentals and leases increased $8,000, and that was due to needing additional space, predominantly for the MREs and the personal protection equipment, water and equipment for volunteer reception center. And then promotional activity increased by $9,900. That was to provide the pamphlets and different publications in different languages, and also possibly new materials based on some of the changing disasters that we've seen recently. The capital outlay increased $134,350, primarily due to machinery and equipment and PC replacement in the EOC, CIC, and that was based on, as we spoke earlier, the lifespan and the recommendation of BTS being in year 7 of a 6 to 8 year piece of equipment. COVID-19 expenditures. There was overtime expenditures, obviously, and to date, I am informed that it's around $50,000. Additional cost was to purchase PPE and cleaning supplies for the shelter programs, and the need for additional sites and transportation assets for hurricane evacuations on the EOC operations, and to follow the CDC guidelines on social distancing may be required in the future. Near future, possibly. Revenues. The revenues, we receive predominantly 2 base grants per year. And one is emergency management performance grant. That is in the amount of $226,000 this year. And then there's an emergency management assistant grant that is $123,300. The first grant is a federal grant, which requires a dollar for dollar match. The good news is the emergency management assistant grant can be used as part of that match up to 50%. So that's a good thing. But what's not shown on this chart is we've recently received an emergency management performance grant supplement of $49,000 in addition to what we show here, and you'll be seeing that come across your agenda soon. And then, of course, ACA mandates the review plan of nursing homes and various facilities be submitted, and there is a charge for that. And as Kristen mentioned earlier, that is set by ACA, and that's their intended collection. And this impact on revenues, this is referring to the $49,000 grant. It is a dollar for dollar match too. It is in the amount of $49,000. They've already identified $11,354 that they're currently spending. The additional $34,062 will either be spent by the end of this fiscal year, or we have through June 30th of 21 to spend it. The good news about this grant is it's retroactive, and that will be coming across your agenda soon as well. But anything spent from April 27, 2020 forward can be counted as a match. So that was a nice little supplement that we received there. User fees, there are no changes to user fees. And that's what I have for the budget. And now I'll turn it over to Kathy so she can give you the real meat of the emergency management operations. Thank you.
Good afternoon, commissioners. Thank you so much for all of your support. In my 18 months here, seems a lot longer. There's been a lot occurring since I arrived. Hopefully it's not due to me. So some of the things that were highlighted in the budget, we did an internal restructuring of our staff, identifying program leads, and this was a direct result of the Evergreen study. This allowed us to have career ladder opportunities within our office, and making those shifts in our staffing really paid off during the COVID-19 response, because we had identified leads within different programmatic areas, and they were able to then take the lead as we went into our COVID-19 response. To give you an idea, over a 3-month period, emergency management has conducted over 540 calls with partners. We've created 56 situation reports and processed over 2,400 resource requests with a fulfillment rate of 98%. Just for COVID alone. We've been activated for over 100 days, and we continue to do our partner calls on a weekly basis and do a weekly situation report to ensure that we're keeping partners informed and gathering information from them. In addition to that, I know most people think of us just previously as the hurricane people and maybe now as the pandemic people. We did have partial activations last year for Tropical Storm Nestor in October, a potential flooding event in December, and we had a severe weather threat in February that actually resulted in an F1 tornado in the Seminole area. So we are here 24/7 for all of you. So it's really important that emergency management is kept in the forefront and that emergency planning. And I think as you've all seen over the past 3 months, that whole community engagement, all the way from all of our big business partners, county government, municipal partners, private nonprofits, all the way down to the individual in the community, that preparedness and response is critical. Just as your conversations this morning were revolving around masks and personal responsibility, everybody plays a role in every type of event that we have here locally. In the first 8 months of fiscal year 20, we have provided 143 public education outreach sessions, and we've reached approximately 6,000 people. COVID-19 obviously has changed the way we do business. We can't do the in-person presentations like we used to, so we have switched over to doing virtual presentations. We've done ones with a lot of our faith-based community. We're planning a summit with our business partners, with our mobile home park communities. So we have beach communities. We're looking to do one just for condo communities. So we continue to evolve as we move forward. And just to give you an idea, so as Kristen mentioned, some of our objectives in our work plan kind of got put on hold, but other things were accelerated. And one of the things that we saw was just a tremendous networking and partnership. So over the last few months, we went from having a distribution list of 44 like nonprofit and faith-based partners to almost 1,300 partners that are now engaged with us on a regular basis and communicating on how do we help our community during tough times. And you know, I know you all are very interested in the shelter scenario and what we're doing for this hurricane season. I wish I could have presented to you before March because we had made tremendous progress in evaluating all of our shelters. We had identified almost 10,000 additional shelter spaces just by going through the current inventory that we had. I was so excited. We were in such a great place. We had gotten to the point where we could expand our square footage to 20 square feet through a category 4 evacuation and to 15 square feet from a category 5 evacuation. That was up from 15 and 10 previously. And then unfortunately COVID-19 hit. So now we do need to schedule for 60 square feet per person. So we have reshuffled, redirected, pivoted, as I've liked to say all along, on how we address the shelter situation. We are actually doing a reassessment of the directional storm surge data to see if we can reduce the number of people that we have to evacuate, also reduce the number of facilities, our long-term care partners that might have to evacuate, and also can we keep some of those shelters on the board for utilization that might not be at risk for the different directions of storms. So we're currently working on that. We've been making real-time updates to our website and our Know Your Zone application to ensure that we can keep the public informed in terms of what are the shelters will be opening, because there are changes this year. We've also implemented push notifications to our Ready Pinellas mobile app, so we can provide real-time information to all of our users. And as you may have seen, our 2020 hurricane guides have come out in English and Spanish, and we've included COVID-19 information and what people can do to protect themselves in all of those publications. So we continue to move forward in working with our community partners. And I just want to thank you for the 2 decision package positions that you did give us last year. Our whole community person that we brought in made a huge difference in helping us to reach out to so many partners. And you can see that by the exponential increase in partners that we've been reaching. And also the WebEOC and EM information specialist that you approved. He has been instrumental in creating new boards on the fly and expanding our capacity and capability for WebEOC. Just to give you an idea, he created an absence tracking board, a special events board, public parks, and the beach access points. And he turned those around in a matter of hours as we were trying to respond to COVID-19. So thank you for all of your support, and I'll answer any questions that you may have.
Yes, Commissioner Eggers.
Well, first of all, Kathy, I just, I'm sure everybody else feels the same way, but really thank you and your team for everything that you've been doing. I'm just tired listening to your report, not tired of your report, tired of the things that you've been going through. It's amazing the amount of work that you put together this past year, talking about the calls, the resource requests, the number of partners that you're working with, including our hurricane, the folks that we have to work with on hurricane preparedness. I am comforted knowing that you're here. So maybe it seemed like longer than a year, but I think getting you here and being a part of our team certainly gives me a sense of logistical excellence that you bring to the table, and the leadership that we need in the community. So really appreciate all that you do. I really don't have any questions, but to say thank you to you and your team. Appreciate that.
Thank you.
Thanks. Commissioner Justice.
Thank you, Madam Chair. And a couple of things. One, that number of partners that jumped that you with the nonprofits and the organizations community, that's remarkable. And I think that's key, as if we can get those organizations to share with their folks the information that we put out, as much as all the information that's shared in the community during times of crisis is the same information and looks the same. That is so critical as we're trying to get people on board with the same message. So that's really, really good. And then to echo what Commissioner Eggers said, for those of us who've been listening to some of those calls for a few months now, and remembering back to some of the discussions that you and your team had to have when we thought this situation was going to be a lot worse than it is right now, I will never forget overhearing some of those calls. And just want to say thank you for all your good work.
Thank you.
Thank you. Commissioner Welch.
I echo my colleagues. Let me first congratulate Frederica and where's the other person? Kristen, yeah, on their backgrounds. Now I know Kristen is downtown St. Pete. That's from the pier. But Frederica, where's your background from?
Clearwater Beach.
Okay, that's somewhere in North County, right? Okay.
Yes.
That's why you didn't recognize it.
But I couldn't agree more with Commissioner Eggers and Justice. Those calls, I've got notes, and there's a Kathy Perkins section in those notes for every meeting, and you were just able to talk about some really scary scenarios and do it with calm, and really reassured me, and I'm sure my colleagues, when you talked about it. Talk a little bit about the shelter space with the new 60-foot standard, what your conversations are with the schools, what they're talking about in terms of restarting schools. Just give us an update on where we are.
So I can't speak to the schools restarting. I haven't had a conversation with them about that. But in terms of hurricane shelters, we have been working very closely with them, because we want to ensure that as we open up the schools, we have PPE for all the staff that are working there. If anyone from the community comes in and they don't have a mask, we'll make masks available for them. We're looking at increased sanitation, especially for our common areas. And, this really has been painful with having to reassess all of the shelter space site. The good news is that all of that work that was done October through December really paid off, because it allowed my health and medical program lead to be able to look at all of these sites and how we were going to utilize those space. So one of the things we did is we actually went back and we looked at how families came in during Hurricane Irma. And that helped us with prioritizing and looking at the space allocation. So, you know, we figure if you come in as a single, you get 60 square feet. If you come in as a family unit of 2, 3 or more, you can reduce that space a little bit more, as long as it doesn't have to be 60 square feet per person. You just have to maintain distance between the next family unit that's in there. So using those calculations, Mecca has actually really mapped out how we'll use each room. And it's almost like, imagine like when you go to a restaurant and you ask for a table for a party of 10 or a party of 4, we've been able to map out how many people we can fit in each room appropriately based upon the family unit size that's coming in. So we've got all of that in place. We're working on all of those public shelters. We're making sure that the shelters that we have are risk appropriate. We have the state doing some engineering assessments on some of the additional sites that we're planning on using. And then we're working very closely right now with the state in terms of how they're rolling out the non-congregate shelter program. In fact, we just got an update from them yesterday as they continue to
Can you
unfold that.
define that term?
The non-congregate shelters, so that would be looking at utilizing hotels or motels that are outside of the evacuation area to try to limit the number of people that are coming into congregate areas. And we say this every year, that everybody should, as a first shot, try to stay with family or friends that are outside of the evacuation zone. It's much more comfortable. And we do recommend that even if you do stay with family or friends, people that you haven't been living with during COVID-19, that you still take those protective measures, still do some social distancing, even within the house where you're going to be staying or the facility you're staying. We're reaching out this year to businesses, churches, any of our partners that might have buildings that would be appropriate for risk sheltering, if they wish to open those up for their employees or their congregates. Certainly that is something that can be done, and that will help us with spreading out people again even more. But we do want people to take those evacuation orders seriously. I don't want somebody to not evacuate because they are concerned about COVID-19. We're going to take every measure that we can to screen people as they come into the sites. If we have suspected cases, then we'll work to separate those, to have separate isolation areas, and to utilize the non-congregate sheltering appropriately.
And final question, Madam Chair, can you speak to you're trying to be more precise with evacuation orders, and you talked about directional surge technology. How mature is that? And tell us a little bit about it, how that'll work.
So the current evacuation map that you see, that is based upon, so if you look at each of your zones, that's based upon every category 1 or 3 or 5 storm coming from every direction. And we know that we're only going to be faced with one storm at a time, thank goodness, with the exception of COVID-19.
Right.
But so that allows us to really look at what is that one particular storm that's coming towards us. So is it a category 3 storm, and what direction it's coming? So what we see is that, and we've just done a preliminary blush of this, we're running the analysis now, and we are going to compare it to another data set that we have as well, just because we want to make sure we're making the most prudent decisions possible. But what we see is, like, for some of our exiting storms, there are shelters now that we take off of the list for every category 3 storm. But if it's an exiting storm, we may not see any storm in that area. So we can keep that school on our list to be able to utilize. And we can also then determine if there are people that are not at danger for storm surge for that particular storm. And we're also going to be reaching out to the National Hurricane Center 48 hours before a storm. They put out what's known as the probabilistic surge model, which is an even smaller subset than what we would see from the directional analysis that we're doing. So again, we're trying to be very prudent in our calculations and what we're looking at. It will be a little bit more challenging in communicating this to the public. And that's why every year we tell people, know your risk, make a plan, and stay informed. And that stay informed is really going to be critical, because the evacuations that we call may be a little bit different this year.
Okay, thank you very much.
Thank you.
Okay, any other questions for Kathy? Yes, Commissioner Seal.
No questions, just a echo of my colleagues. You and your staff have been extremely effective. extremely communicative. I have the utmost faith in everything that you all are doing. It's a very good feeling sitting out here in COVID land, knowing that we have you and your staff there helping us along. So you are amazing, as Commissioner Egger said. Thank you.
Thank you, Commissioner. I'm blessed with a fabulous team and a lot of support from the entire county, and not just county government, but even all of our partners across the community. So thank you to everybody for your support. You helped us make us look good.
Commissioners, we will bring this back at the right time and really talk about all the extraordinary efforts that Kathy, her team, and many community partners did, over the last several months. So we're going to revisit this again, because the stories are pretty exciting, and a lot of her team, used their ingenuity and partner skills to really make a big difference in this. So we do want to do that. We just want to do it at the right time and hopefully in person. But I also wanted to also recognize Frederica. You know her as the person that gets you all your FEMA money. She's our expert in there. Well, we promoted her up, so she received a recent promotion. Wanted to recognize that. Still with us and still performing good work, but she has moved up within the OMB department.
Thank you.
Well, and I also wanted to add my thanks. I hope we're on the backside of this, Kathy, and we don't have to do more, but I, like Commissioner Seal, I feel safer knowing that you guys are there.
Thank you. We'll continue planning and continue working on this.
All right, thank you. Anything else? All right, thank you. Moving on.
Thank you.
Safety and emergency services.
And Jason Miller and Jim Fogarty are up. This is not the largest department, but one of the most complex departments. So go ahead, Jason.
All right, so good afternoon, everyone. My name is Jason Miller with the Office of Management and Budget. I'm joined today by Kristen Kerr again, who will help us go through safety and emergency services, Jim Fogarty, the Bureau Director, and as well as Jody Setchler, who is our Division Director for Ambulance Billing and Financial Services. And just let me know if my screen's up.
Yes.
It is.
Okay, thank you. So before I hand it over to Kristen, we'll just remind everybody that there are 4 different divisions within the department. It has our Ambulance Billing and Financial Services, our Fire and EMS Administration, which includes our Fire Regional Services program, as well as the 12 dependent fire districts, our Radio and Technology Division, and our Regional 911 Division. So with that, I'll hand it over to Kristen to cover the performance summary.
Hello again, Commissioners. This will be my final presentation for today, and we'll see you again for Human Services tomorrow, but thank you for your time. Along with emergency management, Safety and Emergency Services has been on the front lines in response to COVID-19. Safety and Emergency Services has seen that the total ambulance transport volume is down 4.2% year to date through April 30th, 2020. For the month of April, transport volume was down 28.1%, and in March was down 10.7% due to the less demand on the system while the Safer at Home order was in effect. 911 calls also decreased by approximately 19% in April. Safety and Emergency Services remains on schedule for phase 1 of their growth management initiative, which is reflected in the backup attachments, and are working on developing additional outcome and efficiency measures to track ongoing growth in our community. All updates on the department's work plan initiatives can be found in the backup attachments. They have recently completed the evaluation to extend the ambulance services agreement, which is an agenda item that will be brought to you on June 23rd for approval. Additionally, as the county continues to share and leverage countywide data, Safety and Emergency Services is working with the Sheriff's Office, Human Services, and local hospitals to improve coordination around data. These efforts continue to move forward as the department and partner agencies have been sharing data related to COVID-19 response and recovery activities. Finally, as discussed previously, Safety and Emergency Services saw a reduction in average service levels around this time of the year due to the Safer at Home resolution. Yet they have continued to work diligently to coordinate emergency response activities that ensure the safety of our residents, visitors, and personnel. In addition to adjusting transportation flow processes to the hospitals, EMS personnel have lent support to countywide assisted living facilities and nursing homes to screen staff and visitors and have been working with infectious control specialists to mitigate the spread of COVID-19 amongst our most vulnerable populations. That's all I have for performance outcomes, and we'll leave it to the extensive budget we will review together. Thank you for your time today, and I will see you tomorrow.
Thank you. Oops.
Okay, so thank you, Kristen. I will now start to go through the opportunities for efficiencies within the department. First, they continue to focus on and work within growth management for the EMS priority dispatch. Currently, there are 6 agencies who participate, and the department is always looking to continue their initiative to add more agencies. There are a number of call reduction initiatives that the department is working on, including fall prevention training programs, Make the Right Call campaign, and complex case management. As you can see in the graph here, there have been 7 years of medical 911 call growth. And then it started to level off in 2017 when these initiatives were started. Fall prevention in 2017, adding complex case management to 2018, and priority dispatch in 2019. You can see that over the past 3 years, those calls have leveled off at around 180 to 181,000 calls per year. The department also has a number of response improvement initiatives, and they also have several initiatives working toward increasing their ambulance billing revenues. That includes working with the American Ambulance Association on Medicare reimbursement models, as well as the public emergency medical transportation programs for uncompensated costs for Medicaid recipients. The department continues to focus on working with partner agencies to plan out their capital and operational needs for future years. Also looking at leveraging the radio system by adding users to share the costs to run the radio system. And then also analyzing and reviewing, implementing any new fees, such as for wheelchair transport or stretcher van companies that operate within the county. The department does have 3 decision packages for fiscal year 21. The first being managed services, which helps identify any failure points within the 911 network. It has a recurring cost of just under $200,000 per year. Caller location accuracy software. Again, initial upfront costs of over $200,000 with annual maintenance of $15,000, and a tracking software for daily performance for new hires with a small recurring cost of $8,000. The department faces a number of potential threats, such as decreased ambulance revenues. As you can see, over the past few years, there have been a number of items that have reduced those revenues, and you can see their dollar impacts out to the side. As well as the department's been impacted, their operations have been impacted on the Medicaid transition managed medical assistance plan due to the complexity of working those claims. There's a continued increased audit scrutiny on the ambulance industry, where they have to work within those parameters. The non-emergency transport revenue challenges that they face, their ability to keep the ambulance membership program actuarially sound due to rising co-payments and deductibles for insurance plans. 911 staffing continues to be an issue that the department faces, as well as declining revenue sources for both 911 and moving violations, which fund the radio fund. Staffing summary for the department remains consistent over the past 3 years at 200 FTE. And then moving into the budget highlights, beginning with revenues, and we'll start with the Emergency Communications 911 Fund. As I just mentioned, that is a decreasing revenue stream, and budgeting for fiscal year 21, that will be decreasing by approximately $193,000 or 4.3%, and that's just a budget closer to what we've realized revenue-wise over the past 5 years. The fund does receive a general fund transfer, which will be reduced this year by approximately $3.4 million. That's due to a surplus in general fund transfer that the fund has received over the past 2 years because of high vacancy levels. And there is a impact due to COVID-19 for the fund's revenue based on some customers experiencing financial hardships and maybe having a difficult time paying their phone bills, which includes the tax that this revenue has come from. Moving into the radio fund. This is funded by moving violation surcharges on violations issued within the county. Again, another decreasing revenue stream, budgeted to decrease by $36,000 for fiscal year 21 due to lower number of travelers in the area and drivers on the road. This fund also receives a general fund transfer, which will be increasing in fiscal year 21 by approximately $21,000. And COVID is having an impact on the fund of approximately $220,000, again, due to lower travelers in the roads. On to the Emergency Medical Services Fund. Budgeted revenues for the fund are increasing by approximately $7 million. There's two large components to that revenue, one being the ad valorem tax. That's increasing by almost $5.5 million for fiscal year 21. And the second component being ambulance service fees increasing by $3.5 million. And there's been an impact due to COVID of approximately $2.9 million due to the decrease in ambulance transports that Kristen mentioned earlier. For our fire districts fund, revenues are budgeted to increase by approximately $1.3 million. And again, that's due to the ad valorem increases. And the Office of Management and Budget will continue to review each district's millage rate. And if you recall, last year, we were able to reduce 7 different fire district millage rates last year. So as we continue to get updated information from the property appraiser's office, we will continue to analyze that and bring forward any changes at a later date. Moving on to expenditures. We'll again begin with the 911 fund and general fund, looking at the program as a whole. So fiscal year 21 expenditures are budgeted to decrease by approximately $1.2 million. That's largely driven by a decrease in capital needs. There was a large project in fiscal year 20 that's completed. So that brings the budget to budget number down quite a bit, approximately $900,000. And there's been a decrease in operating expenses as well due to some contracted expenses being lower for networking services. Over to radio, again, that's a combined program with the radio fund and general fund. Total expenditures for fiscal year 21 increasing by approximately $290,000. That's largely driven by operating expenses and an increase in their intergovernmental charge for insurance coverage of some of the new equipment and buildings at the radio tower sites. Also, their capital expenditures are increasing by almost $109,000 due to various equipment that needs to be replaced due to the age and useful life of that equipment. Onto the EMS fund. Fiscal year 21 expenditures are increasing by $4.1 million. That's largely driven by our grants and aids or our first responder agreements, which has the largest increase of approximately $2.4 million. That includes both the operations and capital needs of those departments who provide the service on our behalf. And COVID-19 is having an anticipated expected to have a net increase to expenditures of approximately $1.2 million. That's due to increased costs for medical supplies and PPE, as well as a cost reduction or savings on the ambulance contract due to lower ambulance transport. Onto our Fire Regional Services Program, fiscal year 21 expenditures decreasing by approximately $44,000. Personal services has increased by almost $19,000. That's due to the reallocation of a full-time employee to that department that was previously not allocated there. Their operating expenses are decreasing by approximately $65,000 due to a reduced need for travel and training due to COVID. And onto our fire districts. Fiscal year 21 expenditures are increasing by about $580,000. Again, that's largely driven by our grants and aid expenditures to those 12 dependent fire districts who provide the service, as well as for their operating and capital needs. And lastly, the department has a number of user fee changes. For the ambulance user fees, those are proposed to go up 4.6% to follow and keep pace with medical CPI, as well as reflective of annual inflationary increases to provide those services. The membership program fees are proposed to go up approximately 10% to keep that program actuarially sound. And then there are two fees that the department is proposing to eliminate due to not having been used in a number of years. So those two are proposed to be eliminated. So with that, we can open it up to any questions or hand it over to Jim and Jody to provide any more further insight on safety and emergency services.
Commissioners, I told you, a very complex department, lots of funds and different pieces.
Thanks, Barry. If I might, real quickly, I want to thank my team. I want to thank a couple of people, but I also want to thank Doug for not showing fuzzy, cute puppies, because I promised him if he showed puppies, I was going to show fire trucks. So thanks, Doug. Let me introduce my team. Jody Sechler is responsible along with Jason, in keeping track of all the funds, and she's on. But I also want to introduce Judith Wasinski Price, who's our manager of the Regional 911 Center. I'm not sure she's online right now. She is dealing with operations, and our new operations manager that we stole from Nashville, and that's Michelle Peterson. I also want to introduce and thank Jackie Weinrich. She's in charge of the radio and technology part of this organization. And then finally, Craig Hare and all he's done with Fire EMS and his staff. And finally, the 200 people that make it all work. I want to leave plenty of time for questions. It's a large department. It's a very dedicated and passionate department. But the county is in good hands with emergency services, with the people you have employed and challenged to do that. So I'll open it up for any questions.
Do we have any questions? Yes, Commissioner Eggers.
Commissioner Eggers, you're muted.
I'm just testing you, actually. Not again. So just a couple questions. Thank you. It is a pretty broad-based organization and complicated, I guess, with the word used. So two things. One, inter-hospital transfers. Like, I shouldn't say intra, in other words, within the same hospital organization, the rationale behind why they're still charged an ambulance service, why they can't do their own deal. I'm not talking about between a nursing home and a hospital, or I'm about between a hospital that has two hospitals and they need to transport people back and forth. Just trying to understand that a little bit.
So
somebody.
it speaks in general to the way the system is designed. Our Pinellas County system is designed as a single ambulance provider, and that's Sunstar. It's known as by the trade name Sunstar, and we contract to a private company to do that service. And they do emergency and non-emergency, and part of the non-emergency is the interfacility transports. The system is designed to not cherry pick the more well-off hospitals and the lesser well-off hospitals, and it has a performance standard that we meet to do those interfacility transports. Compare that with other systems that have hospital-based ambulances or private-based ambulances, and you have systems that serve hospitals well and other hospitals not so well. The system design that we enjoy has a singular entity that has performance standards. For instance, when a hospital wants someone moved between point A and point B, our contractor has to get there in a specific and understood amount of time. One of the adds to the system that we anticipate for next year is an additional critical care transport truck when BayCare and HCA identified their desire to have these critical patients moved quicker between, say, St. Anthony's and Morton Plant, or between Largo Medical Center and some other hospital. Our critical care is called to do that. And our goal for next year is to do that in less than an hour. So for all of those reasons, our system is not designed to be a hospital-based ambulance system like others, say like Boston, but our system is a single provider that's identified to provide all hospitals and all locations accordingly.
Yeah, and if you have the data on that, I'd love to see the intra hospital transports just to get a feel for it. I'm not talking about St. Anthony's to Bayfront, or I'm talking about within the same organization between their. I just like to see some numbers so I have a appreciation for it. And the second thing is that in the 911 center, there seems to be, and I was just doing some quick numbers, and you had the information online here, a real vacancy problem in our I guess it's telecommunicator positions. 3, telecommunication 2, as high as 23% vacancy. Is that the nature of the industry, or are we having a particular issue that we need to deal with, as in, pay packages or whatever? So just your thoughts.
Well, I think I can answer yes to both questions. It's the nature of the industry. There's very few regional 911 centers on the size and scale of Pinellas County that has full staffing. Most of the organizations have challenges. In addition to that, the expectation for the telecommunicator has grown over the course of the years, and I'm not sure the salary have kept up with that. Now, in Pinellas County, as a result of the Evergreen study, there was some improvements in the salary range, and our turnover rate actually has improved somewhat. We're down, and turnover that I'm quoting here is between the 1 and 3 year mark. If you measure turnover for a 200-person organization, sometimes it can get confused in the averages. But when you look at someone who wants to become a telecommunicator and we hire them as a law enforcement telecommunicator, and to the 3 year mark, when past 3 years, they're likely to stay with us for either a career until there's a more a promotional aspiration that they design. Our 3 year turnover rate is actually in the 15 to 16%, which is industry standard right now.
Okay. Well,
Commissioner, to answer your question, part of that is pay. The Evergreen study was about 2 or 3 years old on their data. So by the time they got around to implementing that is part of the changes. I think I briefed the commissioners on some of the upgrade and improvements that we wanted to make out at 911. Pay is part of it, but that's not the only thing. And part of that is some things that Jim and Lourdes and as a team out at 911 they're working on.
Okay, I mean, that's certainly alarming when you look at telecommunicator 3 and there's 6 vacancies and 4 people in place. Now, maybe that's changed since you've done this, but that's a 60% vacancy in that position alone. So anyway, obviously a concern. So thank you.
Thank you. Commissioner Welch.
Thank you, Madam Chair. I'd like to thank Jim and his team as well, another very complex organization that does a great job for us. I want to ask a couple questions on the EMS fund forecast, which is a beautiful thing compared to what it used to look like. So it looks like we go through FY26, and at that point, we've got a 17% fund balance. And I guess the point where it changes is FY22, where you've got a 6% decrease in ad valorem. Can you talk about that a little bit?
Sure. So that update and that assumption was based on a couple weeks ago when the property appraiser spoke. So the fund this year experienced ad valorem growth, but we're anticipating that to be essentially zeroed out next year. So whatever it came up this year, it will come down equally next year. So almost 2 years of zero growth, due to COVID, and then from there just growing conservatively at 1%, 2%, and 3%.
And we just chip away at fund balance until FY26. So what is the do we have what's the target for fund balance for EMS?
This one's 25%.
Okay. And the 4% increase up under ambulance service fees, is that tied to the contract that we're going to review Tuesday? Is that the CPI piece of that?
Right. So to keep up with medical CPI as well as the increased cost to provide that service, and that's what that's based around.
And I guess this is for further out. Are y'all going to? And this is with flat millage fees, right? Flat
no millage changes, correct.
Okay. Are you going to make a recommendation further out? And I know this is years away, that we stay at the 25, or are you comfortable going down to the 17.2? I guess this is for Barry or Jim.
Well, I think
on that if you'd like.
Yeah, Bill, let me let you deal with that. I've got some comments, but Bill.
Yeah, and first of all, like you said, that's several years out, and there's a lot of uncertainty, especially related to COVID, even to the point that Mike Twitty is our property appraiser, is continuing to work with us to update his assumptions and what he sees happening not only in 22 but also in the out years. And he's already moderated his assumption for 22 somewhat. So we're more in the 3.5% to 4% range. It's looking like, as far as a decrease as of the latest information. But that's a crystal ball that we're going to let him work with. But it's equally hazy as it would be if we had it on our own.
Sure.
As far as the actual reserve target, that 25% really is necessary as a minimum standard. If you recall from several years ago, it had been at 33%, and we moderated it down to 25%. The primary reason for having that large reserve requirement is because in the event of radical change in what our revenue may be because of an event where we don't have the property tax revenue coming in, we still need to be able to pay that ambulance service provider contract, because that is critical to our community and the health of our community. And if we don't have those reserves in place, then we would have to rely on some other funding source to be able to continue to support that. So that supports about a 2.5 month, 3 month reserve level to support that specific need.
Okay. Well, thanks again. And that forecast looks much better than it did just a few years ago. So great work on that. Thank you so much, Madam Chair.
Yes, Commissioner Seal.
Well, thank you very much. I would agree. There's been a lot of progress, and we're fortunate that we've been able to make that progress because of the real estate values. And that's why our fund is stable at this point in time. And let's hope that keeps on going. Any chance that we'll add any more agencies to the priority dispatch? That is such an important effort, and I'd like to see more than 6 agencies.
Well, I think so. I think some agencies are cautiously optimistic. Again, some agencies wanted to wait and see how it was implemented, and it's been implemented successfully. It's expected, and it's performing just as we anticipated it would, safely. it's not without an issue here or there, but in general, it is a very successful approach to priority dispatch. So I'm hopeful that more agencies will choose to join in.
Okay, great. And then two more things. One is somebody sent me a text that they had raised their hand to speak under the emergency management presentation, but was not recognized. So I'll turn that, see if Brian can find it again.
Is it someone from the public, Commissioner Steele?
Yes.
We have
input. Yeah.
Yeah, we weren't going to do public comment.
Budgets.
Okay. So my other concern, I had a good meeting with Jackie Weinrich and Lourdes Benedict and others on the phone. But just so the rest of the commissioners are aware, the state's legislature passed a rule that provides for radio amplification equipment that needs to be installed in condos and in mid-rises. And so this particular development was being impacted by it. So Jackie's going to meet with them, but what kind of comes out of it is something that we all have kind of recognized over the years is we don't run a fire department in Pinellas County, but each of the fire departments has a fire marshal who then makes decisions on how things are implemented and how things are inspected. I sure do wish, especially with this coming down, that may cost the different condos quite a bit of money to install this radio equipment, that their fire marshals get together and have some kind of common response to it all. Because otherwise, I think a few months ago, I received some questions about it. It kind of went away. And then it looks like it's lifting its head because there's implementation for projects under construction, but then there's a date that they have to have it retrofitted in other condos as well. So having some kind of common approach to this would be great, because it's difficult from fire jurisdiction to fire jurisdiction to say, well, this is a mid-rise or this is a high-rise or it applies to this or it doesn't apply to that. And it's just bothersome. So thank you.
Thank you. Commissioner Long.
Commissioner Long, you're muted.
Yeah, no, I got it. So in response to the information that Commissioner Seal was just referencing, thank you, Commissioner Seal. I'm curious about what communication effort was made to notify all of these various condo associations throughout our county that this was a new requirement. Are they all aware? Or is this something that they're going to find out the hard way? Do you know, Commissioner Seal?
You're muted.
I guess that's what I'm trying to go after is they're finding out in different ways, either through the fire marshal, say in Largo, or fire marshal in Clearwater, or, the different
Let me address that, if I may. The fire marshals, as an organization, they meet monthly, and they've been meeting remotely. And tomorrow, as a matter of fact, they're meeting yet again. And it's been on their schedule and radar for over a year that they would enforce a standard and a consistent standard throughout the county. And they're going to be speaking about that tomorrow as well. And I believe, I don't know each individual agency having jurisdiction and how they interact with their organizations, like associations and organizations, and the various providers that this is coming. This is a law that was passed a number of years ago with requirements that they adhere to it, depending on what your building is, as to when you have to meet those requirements. And then there's been a published functional standard about what that all means. So the fire marshals are on board with enforcing it in a consistent manner, and that's their intention. And I know they're revisiting it tomorrow. and we've met with the person that had made contact with you already.
Okay. Anything else? Okay, there's no further questions. We are done. Oh, sorry.
No questions for that. I just wanted one clarification with Barry.
Okay.
I was, during the break, after all of that, 2.5 hours of discussion, trying to craft something for some direction. I just wanted to make sure that Barry felt that he had consensus direction, because it seemed like we started someplace where Commissioner Welch brought up the other county, I think it was Monroe County, and then we it morphed during the conversation to maybe more laser focused and not so broad based, and putting more retail oriented. And then it seemed like towards the end, it kind of got a little bit more like, well, let's just take the simple way and make it for everybody. And I'm not comfortable. I just want to know if he's comfortable, that he has consensus, or they're just going to craft the best thing for us, and that we'll be doing some more cooking on Tuesday. I just want to know what our expectations are, because I think there's still work to do.
Thank you, Commissioner Eggers. You're right.
So what I heard, and Jewel is, can certainly, weigh on this. I heard that you wanted to make this more broad-based, and for indoor type facilities, that there is a requirement for both employees and patrons to wear a mask. That's what I heard you say. Am I correct or incorrect on that?
I think you have some that'll do this, and some will probably do this, or at least I'm doing this. So, and so I just want to make it, that's if you've got 4 or 5 that are saying yes, then I guess that's the direction you're going to go. So because to me, it just didn't come across that way. So I just again want to make sure where we were. So
I think I had 3.5. So I'm not sure I knew I could count that. So I would like some clarification if we could.
I guess
because one of the things was retail interaction, and then we said all businesses. So I'm thinking manufacturing and offices. Did that get thrown in there? And then the part about us requiring our residents to wear it to everywhere that's inside, that's retail or otherwise, versus what I had talked about, which was those places that everybody needs to utilize. I'm not calling them essential, but we actually specifically designate those areas. So it was more limited where we were requiring residents to wear masks. And then I thought there was some kind of, oh yeah, that sounds pretty good. And then we kind of moved away again. So I just,
well, you're absolutely right. We were everywhere.
Well, I've got to talk to a group tonight. And I just want to know. I know how I feel about it, but I don't know what this was. Oh goodness.
Well, yeah. And I guess I ended up with business proprietors and their staff, or retail, basically, because I don't think we can enforce the individuals walking around with no masks. I don't know.
Here goes.
Commissioner Welch.
Definitely not.
Let's not have 2.5 more hours.
Absolutely not. I'm just going to tell Commissioner Eggers where I think we were. I was at the other end of the spectrum, just adopting the Monroe County or adopting the St. Pete, which is all business establishments. Now, St. Pete is just the employees. Monroe County is employees and patrons.
Right.
I thought we got to the point of saying employees and patrons at business establishments, but with a civil penalty instead of criminal, which was the sheriff's concern. And that's where I thought we left it.
So any business or retail or anything indoors or what?
It's indoors.
Just indoors.
That's the Monroe County. Now that's where I started. I don't know where the body is, but I thought we ended up saying patrons and employees at retail indoor businesses with a civil penalty. That's where I thought
You just put retail in there.
Yeah.
Mr. Justice.
Well, that's exactly right, because manufacturing and office and professional services are very different than retail. And quite frankly, most manufacturing, if they're dealing with stuff, they're going to have their own kind of professional masks if they are dealing with dust or chemicals or anything like that. So I thought we were talking about public facing type businesses and employees and situations, not so much the staff that's in the back of the dry cleaner, but the guy that's at the front checking the customers kind of thing. You know, and the enforceability is another part of it. And I think that's, when we get a little further down the road on this, that's probably worthwhile of an entire conversation of its own about how we pass policy about the enforcement of such policy, whether it's COVID or anything.
Right. Well, I think I'm closer to you than to every indoor, but I'm still disturbed by the company that told their employee they could not wear a mask. That one makes me crazy.
Absolutely.
I think that ought to be a clause in there that no employer can tell their employee that.
And Madam Chair, maybe Barry and Jewel should come with a laundry list of things, of options, as opposed to one completely cooked bill. I don't know.
Now, Commissioner, that was actually over in Hillsborough County, what a commissioner raised over there, and I think there was discussion regarding that. So I'll ask Joel to look at that, but that's what it was, is so an employer couldn't prohibit an employee from wearing it.
I mean, that's pretty narrow, but I think that's important, because we've heard stories all along about employers either discouraging or not allowing their employees to wear a mask. So do you feel like you have enough to actually bring something back?
I can take it around a retail, what do you call it, employee, where there's customer interaction. I think the difficulty once we get off this line is going to be defining what that means, and then we're going to have a lot of complaints about or things that are just somewhere in that gray area. I know that'll be the difficulty. I understand. I think your intent. We'll try to look at it, and then we'll bring some options for you to consider on Tuesday. We'll try to get that out in advance, where you can look at it, read it, and then we'll be able to have that debate then.
So you're here like businesses and their employees, not the customers necessarily.
Well, that's not what I heard. I heard that you want the customers too. That's
just trying to clarify.
That's not where I was coming, but that's what I heard from the commission. So, I think I do need that clarification if that's your intent.
Anybody?
I know my intent was those places where everybody must go. Like I'm talking about grocery stores, drug stores, doctor's offices, hospitals. Those places are mandatory. Then the sheriff said, well, what about, like a Walmart? Well, if there's a Walmart grocery store, then yes. If it's a Walmart that has a grocery store, but it also has the other part, no, just grocery stores. Is it a convenience store? No, it's a grocery store. It's a pharmacy, drugstore. If you want to label those, the ones that are there, therefore you guys don't have to sit there and interpret for the next 2-3 weeks for crying out loud. I know you're going to probably have to anyway, but I think the idea here is that businesses obviously are going to take the lead on this to create an air of comfort and safety, not only for their employees, but also for people that are attending their stores that gain comfort. There's some that'll be angry that they have it. There'll be some that'll be saying, "Thank goodness you have it," or or vice versa. So you're not gonna win on it for sure. But I just think that there are certain places, like a 90-year-old person or 70 or a 50 or a 30 should be able to go to a grocery store, get their groceries, and somebody shouldn't be saying, well, they're too old, they don't need to be going there anyway. So don't, that's not fair. That may be the one place that they look forward to going to every single week. And you've taken it away from them, a place of safety, which I'm not saying it's safe. We're trying to minimize risk is really what we're doing. And I for me, those are the kinds of places that I think on our end, the user end, should be wearing masks. Beyond that, it's your choice whether to go or not, as a consumer. So anyway, I was a lot more narrow, and it got there, and then it went back up wide again. And so I guess we'll have that discussion on Tuesday.
Well, I would love to see us mirror what St. Pete has done and what I don't know what Hillsboro's doing. I'd be willing to add the thing about customers in grocery stores and drugstores, doctors' offices, whatever. If you can define that narrowly enough to make the
Commissioner, yeah, that's exactly the problem, and I think why that kind of went sideways when the sheriff started talking about the problems with defining those. And there's going to be a lot of, and we're not going to come up with all the permutations about how much of non-grocery items is it now not a grocery store, and it just gets to be very, very, very complicated from an enforcement standpoint. The way I had heard it, and frankly, I'll be very involved in the drafting of it, was that it would be indoor, but it would be broad-based, at least the initial draft, and certainly we will advertise it with allowing us to make modifications to it during the public hearing while you're discussing it. But I think that's where that got broader again, was that difficulty that you're identifying and the defining things tightly enough to make them enforceable.
So at this point, you're talking about indoor, both business and customers.
That's what I've heard so far from more heads nodding than not, I think.
Well, I just want to see if we can pin down where we're at, Commissioner Eggers. I know that's not what you said.
Yeah, I know. And again, I can count numbers, and I'm not sure I saw the right head nodding and all of that Don did, but whatever. Again, there's an opportunity here to be more laser focused. One of the things that we did in the shutdown is we said that 10% of the people are creating most of the problems, but that we shut everything down for 100% of the people that we could, so that everybody had to kind of get in line, and we had to take care of, there was a small group that we were really, it was that low standard, if you will, of action that we had to take care of, that most people weren't going to abide, or most people were going to abide by it, but there was others that weren't. And so here we have a chance, I think, to be more laser focused on where we're having the problems. And that's where I think Barry was going in the beginning. We having problems in certain areas that we haven't necessarily been addressing or enforcing as much as we could, and where we're seeing the spike in the numbers, and yet now we want to go and just roll everybody into it. And again, I think we have an opportunity to do what is where we're having the problems. And again, again, there may be this, the one thing in the back of my mind that keeps playing is that word exponential growth, right? That the doctors brought up. And so we're going to keep monitoring that super closely, where we might have to change it. But I think really it's about addressing the problem areas, and it's not a problem everywhere. And so this is going to be like, well, too bad. Everybody's going to do it, even though we have an isolated area of problems. And I'm not saying it's small or easy, but it's kind of where we were going in the very beginning with Barry's comments. So I don't know. Again, I guess we'll have more discussion on Tuesday.
Sure will.
My last comment today. Unless Dave Eggers says something else. I would just, staff has heard us, let them come back with a couple of options. I could argue that the person walking in Home Depot has every much of a right to expect that they're not infected by someone than a person walking in Publix. And that's why I support all retail. And I agree with the sheriff that once you start trying to define, that's the problem we ran into with the state orders. But we're making progress. I get it. It's a tough decision. But I think if they come back with a couple of options, we'll be able to make some progress. And by the way, I'm sure everybody saw there were another 142 cases in the last report. So we're still not flattening the curve.
Yeah, no, we're exponential.
Yeah. Right, exactly. Well, and this beats the heck out of shutting down again. So
right.
Let's remember that.
Yeah.
Okay, Barry, okay?
We'll bring A to Z and have a good, healthy discussion on Tuesday.
We'll have a really nice weekend. We will see you all tomorrow.
Thank you, Madam Chair.
All right, thank you.
Bye.